a second to go live, and I'll let you know when it's ready.
Okay. It indicates on my stream custom live streaming, but
Yep, it's good now.
okay. All right. Good morning, everyone. I'm going to call the meeting to order. We will take a roll call, and I'll just advise you at the start of the meeting, by the way, so you know, for next week and going forward, we were given a special present by the governor's office over the weekend. Apparently now there was a modification to the Open Meetings Act. And in those circumstances where we don't have a physical majority available at the county building, every vote must be a roll call vote. So we can no longer do voice votes unless we have a majority of the board physically present at our meetings. So for purposes of next week's Finance Committee and County Board meetings, keep that into consideration. Connor McCarthy will provide some more details on that later on. But for now, Mary, if you would call the roll.
May I just ask a question? Is that second most favorable role, is that now out the window?
At least on remote meetings where the majority of the board is not physically present, we're not going to be able to do that.
Okay.
All right, you ready?
Yes.
All right, Member Chaplin.
Here. Here.
Covert.
Here.
Member Desart.
Here.
Member DeSanti. Member Ecka.
Here. Here. Here.
Member Elliott.
Here.
Member Hart.
Here.
Member Healy. Member Krajewski.
Here.
Member Larson.
Here.
Member Noonan.
Here.
Member Ozog.
Here.
Member Pachowski.
Here.
Member Renahan.
Here.
Member Rutledge.
Here.
Member Selman.
Here.
Member Tornatori.
Here.
Member Zay.
Member Zay has texted me. He's trying to get in. He's having technical difficulties. So we're going to start the meeting. He's going to continue to try to join. But if somebody can touch base with him and try to get him involved, that would be great. With that, we will open up with public comment. Do we have anyone signed up for public comment?
There's one public comment, Mr. Chairman.
Okay, if you would read that, and then if you could also provide some clarification on the Open Meetings Act issue.
Sure. The public comment is from Darlene Rossetti, the Regional Superintendent of Schools. It's regarding repurposing the 505 space for courtroom proposals. The Regional Office of Education appreciates the opportunity to lease from the county space approximately 6,200 square feet at the 505 building. The space is used as a training site to our educators in the county and is part of the duties of the Regional Office of Education, are currently still in effect from August 2017 to November 2021, provides approximately $142,000 annually to pay for the build out and the rent from the county after that. I was not informed until late Monday night that there is a proposal to repurpose that currently renovated space and turn it into courtrooms. In addition, I was informed that another space would be repurposed for the ROE, thus forcing the taxpayers to pay twice. I'm greatly appreciative of not to be displaced, and I am always happy to assist in any way on behalf of the good people of DuPage. However, I feel I must ask my fellow elected officials if during this time of economic crisis, if the proposal being presented is in the best interest of our taxpayers. Sincerely, Dr. Rossetti, Regional Superintendent of Schools. That concludes her comment. On to your request regarding the Open Meetings Act amendment. Late Friday, we determined that the governor had signed Senate Bill 2135 into law. What the bill does as far as the Open Meetings Act is, previously the Open Meetings Act requirement of a physical quorum to be present was suspended. And it basically also suspended the rules with regards to appearing remotely. We had to suspend our rules and ultimately modified our rules so that the members could take advantage of that, because otherwise our more restrictive rules would remain in place while the governor had basically eliminated the rules they were more restrictive than. The current bill added, the signed legislation added Section 7E to the Open Meetings Act, and it permits public bodies to meet remotely, by which I mean without a majority of the board being physically present, when 7 conditions are met. First, the governor has to have issued a disaster declaration in the area where the public body is located. 2, the head of the public body determines that because of the disaster, an in-person meeting is impractical or imprudent. 3rd, all members participating remotely are verified, can hear one another, and can hear all discussion and testimony. Members of the public can hear the discussion and votes of all members from the physical location unless the physical attendance is impractical due to a disaster. Then you have to provide a telephone or web link. At least one member of the public body or the chief administrative officer of the public body or the chief legal counsel of the public body is physically present in the meeting location. And all votes must be conducted by roll call, and also a verbatim recording of the meetings must be made and kept and is subject to FOIA. So there's going to have to be some changes until we have a physical quorum present as far as our normal procedure. Obviously, the biggest change is that every vote needs to be a roll call vote. The other change is going to have to be the requirement for verification. So I'd ask that all members leave their video on so we can verify that you are in fact there. You are who you say you are. You don't have one of those little dipping birds hitting the hand up button on your Zoom call or anything like that. So other than that, I guess I'd be happy to answer any questions members of the board may have about the procedures under Section 7E.
Before we get started, any questions on that?
Chairman.
Um,
Sorry, just to be incredibly particular. So I know some of us, if we get up to go to the restroom, we turn our camera off so you can't see our pajama bottoms or something. Is that now a problem, Connor? Should we?
I think as far as for quorum purposes, because
Right.
I would say just ask to show you're leaving the room so that we can have a record that you, for a temporary purpose, you weren't there.
Okay.
Just in case, I don't know, everyone goes to the bathroom at the same time or something, and it would affect quorum. It's actually a very good question, Member Selman, because the statute doesn't provide what happens if, I don't know, there's what sufficient verification is. And
There's no bathroom section in the statute?
I'm shocked, but no, there is no bathroom section in the statute. So we sort of have to, I hate to say we have to kind of use common sense and do the best we can as we go.
Yeah, sounds good. Thank you.
As long as it's only one person that has the problem, I think you're fine. But if you have a large number of people that are having the issue at the same time, then you have some issues with the meeting maybe.
All right. Thanks, Connor.
Member Rutledge, you had a question?
Chairman, Connor, is this temporary or permanent, or what is the status of this order?
Well, this is a legislation, so it's permanent until amended by future legislation. That's how I would describe it. This is contrary to how these previously had been done by a gubernatorial order. This did go through the legislative process, so it's a part of the statute.
Thanks.
Okay, so we have a lot to cover today. I will go through that out of respect for the board. If this meeting goes longer than normal, and I anticipate that it might given what we have to cover, we can take a break at some point during the meeting if it provide a comfort break for everybody so they don't have to manage the issue of their cameras being on and off. To start the meeting under chairman's remarks, I just wanted to, first of all, thank our staff. They've been doing an incredible job. You all got a very lengthy and incredibly detailed and very impressive PowerPoint presentation yesterday. I tasked the senior staff after our meeting last week with trying to put together some information so that we all wanted to have a meeting where we talk about the CARES Act money and how we spend it, but I didn't think it would be useful or appropriate to say, all right, let's talk about CARES Act, who has ideas, and just throw them out there at the meeting. It wouldn't be very productive. Staff has done a remarkable job of identifying commitments we already have, commitments that we anticipate having going forward, issues that are likely to arise, and then compiling the various presentations and suggestions from all of you in order to give us a coherent way of moving through this process and discussing it. Nick, Cheryl, Joan were on the phone with me and with Vice Chairman of the Finance Committee, Jim Zay, on Sunday afternoon. We were on the call again yesterday. They worked all through the weekend and all day yesterday to put this together to provide us this information. So thank you to all of them. Thank you to Jeff Martinovich, I believe I got that correct, and Stan and their team for providing guidance and information there as well. And thank you to all of you for providing the input that you provided, as well as to our elected officials who provided input. Some of these things were literally coming in very last minute. The issue that was raised in public comment by the regional superintendent of schools, Darlene Rossetti, was a proposal that we received literally yesterday. So it was first that I heard of it. We are not voting on anything today. We are not deciding policy and spending money today. This is an opportunity to identify what we've committed to already and to explore what we may need to commit to going forward. But the board wanted and the staff wanted this board to provide policy guidance as to where we're going to go with this big chunk of money that we've been provided. So this is our opportunity. It need not be our only opportunity, but this is at least our initial opportunity to provide a broad brush policy guidance to our staff as to where we go from this point forward towards the end of the year. So I will open it up and allow everybody the opportunity to speak to all of those issues. And then based upon our discussion today, I'll try to get some sense of the board on some issues so that the staff can walk away from today's meeting with some guidance as to where they need to go. And then more specific proposals can be brought forward for full discussion and voting by the board at future meetings. So with that, I hope we can move together in a bipartisan fashion. I appreciate the passion that everyone brings to these discussions and the thoughtfulness and the ideas that Democrat, Republican, everybody brings to the table. I appreciate that. This is a very thoughtful board, and we're all here for the best interests of the people of DuPage County. So thank you for that. And with that, I will move on to the issue of the CARES Act discussion and turn it over to staff to start the presentation. In past, when we've had these presentations, I've asked that the board allow the entirety of the presentation to go before questions. Given the amount of information that's contained within this report, we're going to try to break it down by section and so that we can have discussions on individual topics. So we'll be taking breaking points along the way to have discussions on individual issues, because I think it'll just be too much to take on at once if we do it otherwise. So Nick, I'll let you take the floor from here.
Thank you, Chairman Larson. Can everybody hear me okay?
Yes.
All right, Wendy is bringing up the PowerPoint here. So without, I think Chairman Larson spoke well on how we did it. So what we, in preparation for today's presentation, we reached out to the elected officials, to the department heads, to have them develop what they thought needs were for dealing with the COVID pandemic. And so what you have here today, the first part of the presentation will be simply what has been approved or obligated so far. And the rest of it is simply a roadmap to start discussions so that we as a staff can understand what the direction is from the board to move forward on some of these initiatives. So we can get started with that. First slide. So today's agenda, I will go through exactly what has been approved or appropriated so far out of the CARES Act funding. Then we're going to move into some of the funding considerations and requests from here in DuPage County, both departments as well as elected officials. We will then turn it over to Mary Keating to talk about some nonprofit residential support possibilities. And then Cheryl Marquet will give a presentation and discussion regarding our local government support. And then we will turn it over to Greg Bedloff for another discussion on Small Business Relief Fund. We'll talk about a potential PPE stockpile, other county initiatives, and then obviously the contingency for the CARES Act funding. Next slide. So this first slide basically outlines what has been approved or appropriated to date. And you can see everything that's gone through board, everything that has been approved by board. The important numbers to realize here, the Small Business Relief Fund, $7 million, that's been approved by board. The COVID capital program that was originally presented to board, that concept was approved, and then various components of that have been approved so far, and more will be coming. That's at a $20.5 million funding level. And then miscellaneous expenditures for emergency expenditures, as well as the plan as far as IT we've spent 1.608 million. So for a total spend to date or appropriated of $29.1 million. So what that means is today we're going to talk how to spend 131.9 million, or at least have a roadmap. Like Chairman Larson said, nothing's being approved today, but this is just helping us establish what the board wants for initiatives moving forward. Everything that is presented today is simply what you're going to see various departments, various elected officials present. It's trying to gather all the information for you as a board to know what the needs of the county are, as well as what the needs or recommended wants from various outside sectors are as well. So before we move on, are there any questions on what we've spent to date or the numbers that we've obligated?
Member Pachowski.
Have all of these agencies been given this amount, and are they in agreement with the amount that is listed on this document?
This amount actually came from our finance department, and this is what has been approved to date. So this is simply this money, the 29.1 million have been approved. So this is what's flowed through the county board so far.
All right, thank you.
Next slide. So the first part of our presentation, we will focus on DuPage County. What are our in-house needs here for battling COVID? We're going to go through the sheriff, health department, election, the clerk of the circuit court, clerk, IT, 18th Judicial Circuit Court, and then we will some care center expenses, and then obviously our long-term expense reimbursement, what the plan is for that, because there's a lot of unknown expenses still ahead of us. So that's just kind of a roadmap. We will dive right in and talk about the various departments. So we talked to the sheriff after we heard the direction from the board of let's get all of the expenses we have so you have all the numbers in front of you. So the sheriff responded with a large number of very small items within the jail to basically strengthen the jail for the current and future battle for COVID. You can see here, like I said, this is I picked many of them off there, but there's still many more. But by far the largest one on here, I mean, we've got laptops, the mattresses. The mattresses were the largest single purchase on here. It's replacing all the mattresses with antimicrobial mattresses for the jail. That was like $450,000. But every single thing on here is in the $5, $10, $15, $20,000 range. So it's just a number of small purchases that will make small improvements within the jail. So we have laptops, the mattresses, replacing the inmate tables in there so that they're cleanable, visitation booth upgrades. We have they've got a number of medical equipment upgrades that will both help detect and hopefully prevent the COVID spread, intercom upgrades because of the COVID. They're proposing a transport van that's specialized for COVID transportation of inmates. They have a number of small air purifying requests out there. They would like to add some staff protection screening, specialized sanitation equipment, UV sterilization equipment. They have some upgrades in their crime lab to make it COVID resistant, air extraction units, temperature screening at various locations. They want to make some day room modifications for the inmates. And then just, like I said, a number of small improvements throughout the jail. So with all of these improvements, once again, we're not asking for approval of these. These will have to be approved through the normal process. We'll have to make sure that we vet these with the auditor, with the finance department, that every single purchase is COVID eligible. But overall, they are asking for a requested funding level of 1.3 million to be considered. And basically this would be a more or less putting a placeholder on that. And as they move forward with implementing these, then they would purchase from that 1.3 not to exceed. I know we have representatives from the sheriff's department. that are on this call that can answer any specific questions. And I guess at that point, I'll open it up for the jail improvements that are being proposed by the sheriff.
All right, anybody with any discussions on this topic? Member Desart. You're on mute, Member Desart.
All right, thank you, Chairman. Nick, remind me, weren't some of these, the air purifying respirator equipment, the air extraction unit, weren't some of these items covered in our already approved capital project?
So the capital plan are building-wide improvements, the entire HVA system. What
Right.
we're talking about here are movable units, small portable units on wheels. It's room upgrades if they know they have a specific patient or inmate that's infected. So these are very small upgrades. These are not capital upgrades.
Excellent, thank you.
Member Rutledge.
Thanks, Chairman. Yeah, Nick, what exactly is a transport van specialized for COVID?
With that, I will probably turn it over to Eddie Moore if he's available to answer a specific question on this.
And again, as we do this, keep in mind that these individual items will come up for discussion and vote on an individual basis. We're looking at larger policy issues, but obviously the board is entitled to ask any questions on any issues they want. Do we have someone from the sheriff's office to answer Member Rutledge's question?
Can you hear me?
Yes.
Hi, this is Commander Mark Boggs. I formulate much of this information. In regards to a transport van, it's a smaller unit, which will allow us to transport individual people while not utilizing our bigger vans that would require more sanitation and affect our inmate transportation unit.
Do you have an idea what the cost of that will be?
We can look it
That
up.
one I remember was.
We'll have to look it up. One second.
I think it was $40,000 if I remember correctly on the list.
Let me see.
All right. Thank you.
Chairman?
So,
Oh, sorry.
Yeah.
I was going to say, as you know, as we move through each of these, I mean, if the will of the board is to decrease, increase, eliminate, I mean, the goal today is I'm going to try to keep a tab of what the direction is from the board. So on each one, if there could be direction, that'd be great.
Chairman, could I ask a question?
I
Did
think
we-
we lost Bob.
Oh,
I think Chairman Larson might have dropped out. Is that correct, Wendy?
so do we need to wait for him to get back then?
Well, I think, Ashley, you can go, you can go ahead and ask your question while he's trying to get back in.
Okay, my question is sort of general. So in relation to like that ban, for example, are we looking at these costs for, yes, we can use them for the interim need, because I think that makes perfect sense to want to have a smaller van you can clean. But making sure like, yes, we can use that equipment going forward, because I'm sure there's reasons that the sheriff would want to transport smaller groups or something. I just want to make sure that these expenses that we're trying to make sure that we're making long-term decisions too, that we're not buying equipment, then in a year, we're gonna have a $40,000 truck we need to sell. So that sort of more just a comment.
Are all of these expenses going to be done by December 31st? And if there's anything that's on the bubble that's close to it, we should know that in all of these expenses.
Absolutely. That the Treasury Department has the guidelines for the COVID expenditures for the CARES Act, and on everything we're talking about, every single one of these will have to meet those requirements. Obviously, a COVID related expense spent by the end of the year and not related to revenue loss, things like that. But to Member Selman's point, we are looking at every single expenditure of, is it usable long term? And will it create more expenses for the department long-term as well?
That's great. Thank you, Nick.
Do we want to move forward on the next
Are
item?
are there any more questions? Anybody have their hand up?
Yeah, I would just like to say to Member Selman's point, it would have been nice to see a line item about how much each item is worth. It just says laptops, antimicrobial mattresses. It doesn't have a line item about how much each item will cost. And that would have been nice to see as well, instead of just an end of 1.3 million, an end balance.
Right, and I think that's what Chairman Larson said. This is just to give us all this stuff. Everybody had been asking, what are we spending money on? What are we not spending money on? So they asked these departments to do it. They will still go through our normal procurement policy when they come forward before us to be approved each item.
For
So
Nick-
we're not approving it today. We're just getting a ballpark figure of what these departments are asking for.
Yeah, I understand that. And so Nick, for my input, I if the sheriff thinks he needs these things, I would, my impression is to go ahead and budget this request.
Sorry about that, folks. I got cut off there. I'm back. Sure you were ably led by Member Zay in the interim. Any other questions or comments on this topic? All right, seeing and hearing none. Nick, you want to continue?
Absolutely. So our next section in the presentation is a health department. And obviously this is a substantial effort for the county, since they're kind of our front line for the COVID battle. So I'm going to turn this over to Karen Ayala to kind of go through what her plan is moving forward for the COVID expenses.
Good morning, and thank you so much, Nick and county board members, for the opportunity to walk through our request. As Nick pointed out, public health, since it is a public health emergency and we are the lead agency, our allocation is understandably large and yet represents less than 10% of the overall allocation for the county. We used buckets to kind of articulate our needs. And again, I would offer the same kind of disclaimer, in that these are not purchases that are innately approved or automatically approved by the Board of Health. That this is a categorization of the areas of funding that we anticipate needing to support our public health response from now until the end of the calendar year. Certainly the greatest area of our response or our request is under the ongoing response operations. We have had staff time dedicated to response activities. These staff are typically funded through either grants that they have not been able to bill for, or they are allocated in other areas, supported by other areas, such as billing for services that we have not been able to provide. But the ongoing response operations also includes funding for sanitizing supplies, PPE for both our own staff as well as our first responder partners, those individuals who we have been offering and providing allocations to since the start of this event. Retrofitting our facilities, including things like sneeze guards, and making sure that there's enough space once we get individuals back into our building to accommodate safely. Media and community-based public health efforts have been provided to date. We've also had to expand our medical consulting staff Clearly, you all know Dr. Chug, but she is one person, and although she is able to work pretty much around the clock, we've had need to bring in other resources, other physicians to assist her. We're also looking at making sure that in our response, particularly going forward, now that we have data to identify that there are racial and ethnic disparities, that we have plans and responses to address those disparities in attacking COVID-related illness and death. The second bucket is public education and messaging. We are requesting a total of $2.5 million, which again is a significant amount. One of the primary reasons for allocating this level of support in our request is that we have been working very hard over the last 6 months and feel that it is extremely important to have consistent messaging and promotion across our community. So what we are anticipating is that we will generate the public messaging, push out to our sector partners, whether that be the health providers or mayors and managers or fire police or some of our general public facing messaging, whether that be schools or businesses or places of worship. So our allocation includes sufficient funding for that. The third bucket we have is for COVID testing. As you are all aware, this is the first day of our community-based testing site being operational. In the first hour, we have tested which ended at 8 o'clock. We have tested about 25% of our overall daily quantities. So we've had, in that first hour, we had 79 vehicles and 110 tests that were run with our daily cap at 400. So it's incredibly early in our process, but we are seeing that people are anxious to receive testing in a DuPage County location. So the COVID testing numbers account for the amount that the county is supporting for that testing site. After 8 to 10 weeks of that testing site being up and operational, we are looking at evaluating a large community-based site and moving into more mobile testing so that we are able to accommodate increasingly individuals who may not have the means to travel even within the county to be tested. And so we have included request for that amount, which totals 3.4 million. We have received we have applied for a case investigation and contact tracing grant through the Illinois Department of Public Health. The total for that grant was $4.9 million. That allows us to increase our staffing response, which is the primary source of our request for that funding, to bring on 110 individuals. Clearly, that is not nearly the level that is being recommended by National Public Health resources. They indicate that a community our size would require about 300 individuals. So we are requesting some additional support that will bring us closer to that 300. One of the opportunities going into our telehealth investment, one of the opportunities that this crisis or pandemic has afforded us is that we have been able to move from office-based to telehealth for our behavioral health clients and some of our other clientele that can be served through telehealth. We have seen that not only are clients very appreciative of this opportunity, but oftentimes, particularly with individuals who struggle with transportation, this is in fact a preference over coming into the building. So we're requesting additional support for that. Additional IT software and infrastructure upgrades include our pre-work and our preparation for mass vaccination operations, particularly around our IT infrastructure. We also have the need to develop and bring online an asset management system. We need to provide data collection and other IT management system upgrades. The next to last bucket is for alternate housing for isolation and quarantine. Local health departments do bear the responsibility for containing diseases such as COVID-19. We know that finding housing for individuals that must be isolated from others and cannot return to their homes, or who have been exposed and are reluctant to potentially expose individuals who have healthcare vulnerabilities in their home, will be an ongoing need. So we're requesting funding to support those efforts going forward. Initially, those efforts were supported by the state, and those have now been transitioned exclusively to local health departments. And finally, in the event that there is a there is a vaccine available by the end of the year, we also know that we will need to increase our resources, whether that be through partnerships with other community groups or partners who are able to deliver the vaccination, or if it will be hiring on temporary staff to provide it through the health department. But we have based those costs on our experience with H1N1.
All right, questions from the
Yes.
board? Member Pachowski, then Member Ozai. You're on mute, Don.
Addison has a huge industrial park, and I could see a situation where a factory which hires a lot of minorities might have a outbreak. Does the mobile testing capability or allow staff to provide healthcare services remotely deal with issues where a factory has a huge outbreak of positive cases? And would those be handled at that location, or is this something that is part of this proposal?
That would be exactly the use of a mobile testing site, would be to be able to intervene very quickly where we see exposures and potential outbreaks occurring, so that we can get a handle on those situations very, very quickly. So yes, that would be a prime example of that mobile testing capacity.
I thank you, Karen.
I remember Ozai, then Member Hart, then Member Elliott.
First of all, thank you, Mr. Chairman. First of all, thank you, Karen, to you and your staff for how incredibly hard you've been working these past 3 to 4 months, and just really appreciate and can't imagine what you guys have been up against. I do have a comment about something that I'm concerned about. Is there any provision, I'm thinking either under number 1 or number 2, for some kind of a public distribution of PPE? In particular, I'm thinking about wipes, hand sanitizers, masks. In my own experience, I have seen hand wipes in the stores maybe twice in the last month. I saw masks one time. These would be just the surgical masks. I know people are making and purchasing, cloth masks, but is there some type of provision? For instance, distributing this to restaurants, distributing these to stores. I'm thinking about the basic surgical mask, not the N95s, but something along these lines to promote the usage. Even this past week, I've been noticing right around my area, people aren't wearing masks. And all we hear from the CDC is that both you should be wearing a mask to protect others and others should be wearing a mask to protect you. So if you have any comment about any proposal, or if that's not part of what you can do, I would like the board to consider some kind of a public distribution of PPE. Thank you.
So yes, our allocation request was for specifically healthcare and first responders. However, your point, Member Ozog, is absolutely on track, and I think we're getting into mosquito season, and we saw that outdoor events and outdoor parks began distributing things like DEET repellent for people to help them reduce the risk of exposure to West Nile virus and other mosquito-borne illnesses. I think that it is a good idea to have supplies ready, particularly for more vulnerable or at risk or less able to afford or access those kinds of pieces of protective equipment. I think helping people keep themselves safe is probably the best solution as we move forward and open up our communities.
Well, please let's keep that in mind about trying to provide more PPE to the public. Thank you, Karen. I really appreciate your work.
Thank you.
Thanks, Member Ozog. Member Hart.
Thank you, Mr. Chairman. Sorry, I was having issues with my mute button. Karen, thank you again for all that your team is doing, and thanks for this presentation today. I have a question on number 8, mass vaccination efforts. If I heard you correctly, I think you said that of that 350,000, most of it was going towards resourcing. So for temporary hires, for example, that may need to be on to help the mass vaccination effort. My question is, and I know we don't have a crystal ball, but under what circumstance do you think we as the County of DuPage would be responsible for procuring the actual vaccinations themselves? I'm curious to hear your thoughts, because at first glance, 350,000 vaccination efforts seemed somewhat to me. So wanted to see if you had any additional insight you could share.
So I think our numbers are very conservative with this particular strategy, in part because there probably won't be sufficient or robust supply of vaccine for the entire community. So it will be most likely coordinating and helping to identify those who are in priority categories and to provide that information. The other is that our model for these mass vaccination efforts, particularly if you look at flu, are really to help support private providers who have access to the same vaccine and to really drive people and encourage people to access the vaccination through their usual source of medical care versus standing up an entirely separate clinic for that. So I think it provides us with sufficient funds to begin to have those efforts started. It also takes into account that there would most likely be additional funding from and through the Illinois Department of Public Health to assist us with those efforts.
Thank you.
All right, Member Elliott, then Member Renahan, and Member Eckhoff.
So Karen, thanks. I'll echo Members Ozog and Hart said, thanks to you and your team for all you're doing. I share Member Hart's, I guess, concern about what the expenses might look like for future vaccination. I get worried that we're going to have mandates coming our way from the federal and state governments without funding for that. I guess my question, though, is more focused on number 2, the public education and messaging. My immediate reaction was that seemed like a big number. I'm assuming perhaps that's because there are some anticipated big broadcast buys in there. But I'm wondering if you could give us maybe a little bit more of a breakdown on how you got that number. And are you contemplating retaining staff or consultants to run the messaging?
We are primarily entertaining the purchase of platforms to expand this messaging. So but it's more than public education. So it's layered. It's, there may be targeted messaging to medical providers, for instance, on how to articulate the need for isolation and quarantine. We're still seeing that, when individuals are getting tested at a primary care provider, the primary care provider may not be asking the questions about, do you have a place to isolate and quarantine yourself? So we're also seeing messaging to community partner organizations around how to protect individuals who are particularly vulnerable. And so it is a layered and multifaceted approach, which has somewhat of an evolving process that goes along with it. Because right now, of course, we're pushing messaging about isolation, quarantine, testing if you have symptoms, the social distancing, the wear a mask, the wash your hands kinds of things, but we don't really know what to expect the next round of public messaging to be. We also are looking at messaging around our more intensive case investigation and contact tracing efforts. We've heard, across the country that people are really unsure about providing health information to somebody who calls them on the phone. So it's going to be providing them education on what to expect if somebody calls you with 30 minutes of questions, and what questions should you not answer. What might be a tip that someone is trying to trick you into providing you with information, very similarly to how the census information, like we would not be asking you for a credit card number. We would not be asking you for social security information, that kind of thing. So it is a large number. And I think that it was designed to be large, not so much based upon a specific calculation, but it provides us with the best avenue of reaching many, many people, 1 million people, with these key messages and helping make them repetitive by engaging and enlisting the help of our community partners.
Move on to Member Renahan and then Member Eckhoff and then Member DeCiani. I will note that obviously this is a great example of why we need to maintain flexibility in what we're doing here. We don't know what some of those expenses are going to be come September, October, November. So as much as we'd like to commit as much of this money as we can, we need to take that into consideration. Member Renahan.
Thank you, Mr. Chairman, and thank you, Karen, for everything you're doing. I don't think there's anywhere that's more important than the health department in terms of where we're putting this money. I do have a question about the mobile setup. How is that envisioned? Are we talking like animal services where there's going to be a mobile actual, vehicle, or is this kind of just, capacity people? Can you just elaborate?
Yeah, certainly. So the mobile units that have been used, again, we're better off if we can test people outside. So I don't anticipate it being like a mobile unit, but there will be certainly physical kinds of barriers that need to be included. So we have talked with even county grounds people to help develop, you know, a table with a glass or plastic kind of shield that we could use as we set up. I'm thinking kind of like even almost a lemonade stand on a corner, and have people walk up, but yet keep that physical barrier in place for them. So there will be some equipment that's needed, but primarily it is just getting the supplies into the neighborhoods and the communities that we're going.
Okay, I would just add, you know, in my view, the animal service has been very successful with their spaying and neutering program. It seems like, you know, maybe we could have an actual vehicle that does testing and then, you know, can later be used for vaccinations of, you know, kids in low income, you know, neighborhoods. I don't know. I just think there might be an opportunity there. And then just a quick note on kind of highs and lows policy wise. Kind of agree with Member Elliott. To me, the public education and messaging, it seems that we could probably coattail off the CDC and IDPH and probably get what we needed. And that's 2.5 is a lot of money to spend by December. And then on the low side, I'm just wondering if you budgeted enough on the testing and also the vaccination as well. I mean, I don't know that by December we're going to be there for the vaccination, but certainly for the testing, I just want to make sure that you get all you need. So
thank you. Thanks.
Thank you, Member Eckhoff, and then Member DeCiani.
Hi, Karen. Thanks for all your hard work. I just had a question, two questions. One was about senior centers. Is there anything that we could be doing or should be doing to help fortify those? Because that seems where the greatest risk to the population is. And I don't know how we're working. I don't even know how many senior centers we have in DuPage County or where they're all located, but it seems to me we should be doing something to help them out.
Yes, Member Eckhoff, you're absolutely right. And we have seen a lot of support for long-term care facilities, nursing home facilities, but we have even more independent living, senior centers where people may come for lunches or recreational kinds of events. And again, those back to Member Pachowski's example of a business, those two would be opportunities to provide that mobile testing. Absolutely.
Well, I'm not talking just about mobile testing, but what we're doing at the courthouse and what they're doing at other places about the sensors where if somebody walks into the building, they're immediately tested.
Sure.
Is that what you're talking about, or are you talking about just the regular?
No, our request is only around the testing and education, and potentially the contact tracing is where we would intervene with those groups.
Yeah, but senior citizen homes or contact tracing is going to be everybody else in the home. I mean, it just seems to me that I don't know if we're doing anything special for them or not that we do in the convalescence center or in the jail, but I'd like some better, I don't know if there's, I don't want to say better, but you know, strong efforts in that area. And then just wanted to chime in the public education and messaging. It doesn't seem like you can turn on a news show or half the other shows these days and not get information about this. So I was hoping that with the cooperation of local TV stations and that, this wouldn't cost so much money. And then the PPE that you were talking about, I mean, are you expecting to have a distribution center for people for masks and things like that? That seems.
We are anticipating a continuation of the distribution to first responders and our healthcare partners, particularly long-term care centers. In our call earlier this morning with the healthcare systems, all of our healthcare systems are continuing in conservation use of PPE. So this is something that we anticipate we will be needing for some time.
Yeah, I mean, I definitely agree with first responders and healthcare professionals and things like that. I thought you were talking about having some public distribution of PPE.
I think that was Member Ozog's idea, which is not included in our allocation, but I think if done in a targeted way would be a great idea.
Yeah, well, seems like everybody can afford a mask, so they should have a little self-responsibility and take care of themselves. But that's all I have, Mr. Chairman.
Thank you, Member DeCiani, followed by Member Chaplin, followed by Member Pachalski.
Mr. Chairman, thank you, Karen, for all of your hard work. Was out at the opening for the testing site and with some of our fellow board members, and it's very organized. A lot of county, obviously, a lot of county labor involved in that because we're pretty much the state has given us testing equipment, the kids should say, and doing the lab work, but pretty much the county's running the testing site, which is I think pretty impressive. My question on follow-up for the public messaging is most of that 2.5 million labor, like in-house or outsourced labor, or is it actually TV guys? What are you looking at there? Because social media doesn't cost much money.
Right. It will be a combination of those things. It will be, in addition to that, it will be production costs. If we're centralizing our messaging and want businesses and communities to use it, then providing them with those resources to make sure that they have availability will also be a part of that.
Okay, just to keep in mind, Addison has their own broadcast station and their own equipment and manpower, and I'm sure we could access that for little to no cost. So if we could partner with some of our municipalities and take advantage of those resources that are free, that'd be awesome. And they actually have 2 full-time channels there, and per capita, they're the largest town affected. So it kind of, you scratch a lot of itches, save some money, and probably get you a lot of traction and messaging to Latinos and to some of our more vulnerable populations. I've got allocated 2.5 million on an east side of the county testing site, and talking to my mayors, they definitely would like to have something on the east side. So we're looking to put a collaboration together and try to incorporate not only testing, but potentially blood donation. Remember Rutledge brought up her successful friend that had the blood plasma treatment and recovered. It's more and more effective. I know it's being studied, but knowing that until a vaccine is in place, these are treatments that are being currently used and having good success. I'll be looking at that over the next couple of weeks as part of our HHS committee, include you naturally in that process. But right now, we have no other than what I'm trying to propose here for the east side, we don't have anything proposed on your end for the east side, correct?
No, as far as testing sites, we don't have those sites identified at this point yet. We've been frankly focusing on getting the one side up and running today. So we will begin to take a look at that. And yeah, I understand that the public education messaging is a significant amount. Again, I would just remind you that we're not sure what the messaging and the education is going to include as this virus continues to evolve. I would imagine that part of the public education messaging for this upcoming year, we're probably 60 days out from starting our flu vaccination campaigns. I think that part of, just like early on in this pandemic, part of the messaging will be get your flu shot, because the worst thing that could happen is to get both flu and COVID. So I think that I absolutely hear the concerns of multiple board members on the amount for that. It is one of those that I would rather have sufficient supplies or resources to address that and not need that, and potentially be able to reallocate to an additional COVID testing mobile site. But at the same time, if we needed something and we didn't have the funding, then I wouldn't feel like we had done a good job in anticipating the needs either. So I appreciate the feedback.
Karen, as a follow-up on the cotton masks, I know we're not giving out any reusable masks. I know talking to my superintendents in my district, I'm giving like 3 cotton masks to every student and 2 cotton masks to every employee, teacher, et cetera, staff member. We don't have any plans right now for reusable masks. I'm thinking for the seniors and maybe for some of our lower income areas where, education is important and maybe, they're wearing the same disposable masks on and on and on and on. COVID's not going to be, gone for at least another 8 to 12 months. So the need for reusable masks is going to be more important. You see us possibly invest in those at all for those folks and incorporating maybe that with the public education side for these lower income minority areas?
I certainly would not rule that out. I think that's it could be a part, we could incorporate that, yes.
Okay, thank you.
Member Chaplin, followed by Member Pachalski.
Thank you, Chairman. And Karen, I just want to thank your department for all the work you're doing and the information that you've been sending us. The tour of the new drive-up facility was such a great tour, and you guys are doing really good work. So my question is, this amount that you have for the COVID testing, will that sustain you through the fall if we have a second wave? Because I know that we may keep this facility open right now about 8 weeks. Does that funding include possibly going a little bit longer and into the fall?
It is. It allows us, we anticipate and budgeted for an additional 150,000 tests in our allocation. And again, those would be in addition to what our healthcare and other partners are providing.
Okay, thank you. And then I just wanted to touch on it. Maybe this might be a discussion later on in the meeting, but this PPE distribution, I read that Kane County was doing care packages for their citizens. So what they were putting in there was a mask, hand sanitizers, I think disinfectant wipes and gloves, something like that. We know that, washing, keeping our hands clean, wearing masks, keeping our surfaces clean, that helps prevent the spread of COVID-19. So I think it's really important. And go to any store. For me, these products are not readily available. It's very hard to find hand sanitizer. We're like down to our last couple ounces of it. So I think if we could do purchasing and put together care packages and especially disperse those out in the lower income areas, but for anybody that might need them, I think that would be such a valuable service that we could provide. And I like the idea of putting in, if we could order, I know the county has the cloth masks that they were handing out to employees. So if we could put cloth masks in there maybe so that they're reusable, I think that would be really a worthwhile initiative for us to consider. And maybe this isn't the spot, I think it might be down farther in the presentation, but I did just want to make that point. So thank you very much.
Yeah, and you're correct, Member Chaplin, that we are going to have there is a point. I know we were providing a lot of information. We're trying to get as much information as possible to everyone as it comes in rapid fire succession, but there will be a further discussion down the line of this today regarding PPE specifically. But thank you for that, Member Pachalski.
Karen, with about 75% of our cases being seniors who are in various facilities, I think that's an immediate need that needs to be addressed. Should we have put that separately as to how we're going to be handling seniors in these facilities who seem to be, with such a high percentage of those testing positive? How are we dealing with that specific issue?
So yes, they certainly represent 75% of the deaths, COVID deaths in our community. As far as cases, they represent under 20%. But I think the point of pulling out pulling out the vulnerable populations, that's part of our ongoing response operations. So not only do we see ethnic and racial disparities, but we also see the individuals in congregate living, such as the long-term care facilities, like the care center and approximately 50 others across the county, who have weathered the first wave of this, certainly we know that they remain vulnerable, and we've also gotten lots of interest and inquiry from these independent living facilities, that everybody has their own apartment, that they come together for a lot of times for activities, and they are feeling very overlooked and forgotten with the focus on long-term care facilities. So that would be absolutely part of our ongoing response operations. And as we go forward, as Nick stated, if this funding request is approved conceptually today, we can certainly do more detailed kind of estimate of and develop an implementation plan to provide you all with going forward.
Thanks, Karen. Just as a reminder to the board members, I see some folks have turned their cameras off. I know it's inconvenient. We were given some guidance from our state's attorney that because of the changes to the Open Meetings Act issue over the weekend, we need to be able to confirm presence throughout the meeting. So if those who have their cameras off could turn them back on, I'd appreciate it. I see Member Ozog has a question. Go ahead, Member Ozog.
Thank you, Mr. Chairman. My first question is for you, actually. What exactly will we be voting on when we decide how to allocate this money? I'm assuming we'll be voting on buckets of funding based on department. Is that correct?
Yes, all of the expenditures are going to be going through the regular expenditure process, usually by committee and then up through the Finance Committee and through the county board. What we're trying to do is determine, rather than just waiting until we get to a point where now we've got $200 million in requests and people sending us stuff for approval, and we've run out of money. We want to try to understand where this money is going up front and provide the board opportunity to guide where we think this money should be allocated. But if the individual expenditures are coming in, they're going to have to be approved on an individual basis.
Right. But when we approve this, I assume at the next board meeting next week, will we be approving $16 million for the health department? Is that how we're going to be working this specifically? My main question is, how much flexibility will department leaders have with the money that they've presented here, for instance, if they find their needs changed, et cetera?
So the concept behind what we're trying to do is provide not necessarily a hard cap, but we've asked the different department heads, elected officials to provide us a concept of what they anticipate spending. Obviously, for instance, in Karen's case, we're not going to say, this is it, this is all you get, figure out how to spend it, nor are we writing a check to the health department for $16 million. But we wanted to get a sense of where everybody is looking in terms of dollar amount, and then go to the board and say, is this something that you're comfortable with as a category? Or, for instance, people have raised questions about the public messaging and whether that's an expense that should be focused on as opposed to something else. And so we want the board's input into those broader categories, and we can be flexible. I think we need to be flexible as we go forward. As we said, we don't know what the health department may need in September, October, November, which is why we're building in some contingencies and so forth. But everybody has heard this $161 million figure. Sounds like a lot of money, but as you can see through this presentation, a lot of it can go pretty quickly. And so we wanted guidance from the board. It sort of started with this question when the mayors and managers said, give us $43 million. And I said, all right, well, let's figure out all these other buckets that we're going to need and get the board's guidance, because you all decide ultimately where this money goes, with the staff providing some input and information and how these numbers lay out.
Okay, thank you, Mr. Chairman. On that thought, building on that thought, Member Eckhoff referred to people having personal responsibility to buy their own masks, et cetera. And my issue is not about personal responsibility so much as availability. And now I'm going to speak as a member of the public. I was at Costco within the last 10 days. I just happened, as I was heading toward the paper towel aisle, to see a manager standing there in front of a pallet of 5 packs of Clorox wipes. And he was standing there handing them out, and the pallet was gone within 10 minutes. And that is I think I've seen them in one other store once. And then I saw masks once at Myers, and the masks were the light surgical mask, $34.99 for 50 masks. That's 70 cents a piece. So my issue is availability and cost, but if that is something that we can dedicate, I'm going to throw out a figure of $1 million to get PPE to our restaurants, our stores, so that they can distribute these masks if somebody's coming in there without a mask. And it's, I think, a really important challenge that we have to face, because we're hearing now, I know the message was not really clear in the beginning, but wearing masks is an important way to counteract this pandemic. So masks, wipes, hand sanitizer, I think we really need to do something. Again, piggybacking on Member Chaplin's idea that we have some kind of a public distribution, and I'm not sure where we put that. Perhaps it does go into this public education and messaging. $2.5 million does seem excessive to me. Maybe $1 million of that could be PPE. Before we vote on this, I'd really like to see a dedicated place where public PPE can be allocated. Maybe we do it through village halls, or I'm not quite sure, maybe we do it through chambers of commerce, but I think we really need to provide somehow actual PPE in our public's hands. Thank you.
And again, there is going to be a discussion further today regarding PPE specifically. And we will get to that point. Part of the issue,
okay,
availability on our end and our ability to purchase it, because as you know, you could give us $20 million and to spend, and that doesn't mean that we can buy all the masks that we want and all that, because it's just not available, and we're trying to.
I understand, but I do think our availability is probably easier than the public's, and that's been my own personal experience. These wipes were one pallet and they were gone. So that's what I think is going on out there. Thank you.
We buy it all and then it's not in the stores.
All right, let's try to kind of keep this going. We got a lot of people still wanting to talk. Member Elliott?
I was just going to say, Chairman Larson, I share Member Ozog's concern. Skipping ahead though to the last sort of page of this presentation, there is a $3 million line item coming up, right? That's general population use.
Well, it's going to be a discussion of how we want to allocate that, but that is going to be a discussion.
Okay, so there is a line item. We can talk about the number that's coming up. Yes.
Yes.
Okay. Thank you, Mr. Elliott.
All right, any further discussion? Obviously, we have a lot to cover today, but I want to give everybody their opportunity to speak to every issue if they need it. Any further discussion on this subject? Seeing and hearing none. Thank you, Karen, very much. I think we all salute the tremendous efforts of the health department as you go through this. We'll look forward to further information and guidance as it goes along. We move on to the county clerk presentation.
Thank you. So at the health department, as I understand, the 16 million number is acceptable for a bucket at this time moving forward. So our next part of the presentation is going to be the county clerk regarding the election requirements moving forward. And I think Adam Johnson is on the line to give this presentation.
All right, Adam's just popping in. It's Don Carlson. So sorry, I lost Wi-Fi and had to walk in to get on Don's computer. Can you hear me? You can sit anywhere.
Yes, we can hear you.
Okay.
Deputy Clerk.
Okay. Thank you to the board for having us. Also, thanks especially to Nick, who's been very collaborative and helpful through this whole process. So the first slide here, just wanted to take you through some of the expanded responsibilities that have been put in our office's lap over the last couple of months. We have it divided out here between the mandates specifically from Illinois SB 1863 and also the general COVID response. The legislation that was passed about 3 weeks ago, I believe it's actually expected to be signed today, gives some specific new mandates to county clerks. They're listed there. We now have to mail a vote by mail application to all voters from the last 3 elections. There has to be a county-wide election day voting center. We set up something somewhat similar to that at the county fairgrounds in the primary as a replacement for the assisted living facilities we lost as polling places. So now we're going to be back at the fairgrounds on election day in November. We're required to expand early voting hours and implement some new state guidance for safety and health practices. And then that little last bullet point, all of those new requirements were with no diminishment of any of our existing requirements for number of polling places, election judges, and everything that we were already required to do for election day. So they didn't reduce anything. They just added more onto what election administration was required. And then also, regardless of those mandates, just as a general response to the COVID-19 situation, obviously we're going to have more vote by mail volume and demand for early voting. We need to give notification to the voters of changes that are being made at polling places, and also communicating that they are encouraged to take advantage of the early voting and vote by mail options. We anticipate having additional difficulty recruiting and retaining election judges. Leading into the primary, we had a mass exodus of judges to the point that we had to make a last minute increase in pay, and we're signing up judges as late as the morning of the election. And we're just barely able to maintain sufficient staffing in that way. So we anticipate, also based on what we've seen from other states in the intervening months, that election judges will continue to be a challenge. And then finally, we wanted to stress that even above and beyond the mandates in terms of what the state's telling us to do, it's our goal to maximize the safety and access for DuPage County voters, even if that means going beyond what the state is telling us at a minimum that we have to do. We'll address some of that on the next slide. Whoever has control of the slides, got it. So here's an overview of the high-level cost and funding situation. We have a few different buckets to potentially draw from. You see there at the top, there's the CARES Act had some funding specifically dedicated to elections. It was $400 million nationwide, so Illinois' share of that is $16.7 million. That went to the State Board of Elections, and they have not, as of yet, formalized how that money is going to be distributed, whether it's going to be on a per capita basis, whether there are going to be any strings attached to it. That $1.2 million is essentially a per capita estimate. If the money was distributed on that basis, that would be roughly DuPage's share. We have gotten an indication that at least that is a method that the state Board of Elections is giving consideration to, maybe even leaning in that direction, but that has not been made official yet. And obviously there's the general coronavirus relief fund that we're discussing here today. And then there is the possibility of future legislation. The HEROES Act, which has passed the U.S. House of Representatives, does have $3.6 billion in there for additional election funding nationwide. But that has not been taken up and approved by the Senate. We don't know, again, how that'll shake out when any legislation gets passed, what the final number might be, and then how it would be distributed down to the county level. Meanwhile, we still have the election to run, and we're having to move forward with purchases and staffing in order to carry out the different responsibilities we have. So that's why we're coming to the board today, asking for a backstop out of the coronavirus relief fund. We've identified additional costs that we know we're having to move forward with, and so we need to know that the money is going to be there from somewhere. And right now we have not gotten a firm allocation of additional election-specific funding. So I'll go into more detail on those different categories on the next. Oh, sorry, I did want to touch on the very bottom there, where we note that, as I said previously, we're not looking to just meet the minimum requirements of the statute, but we do want to maximize access to all voters. And so even though the state law is only requiring us to send vote by mail applications to voters from the last 3 elections, we are intending to send those applications to all registered voters. So now we can look at the next slide. So these are the different specific expenditures that were rolled up into the line items on the previous slide. We have additional equipment and systems that we need to purchase, mail sorter, printers, a tabbing machine and postage meter. We also need to make upgrades to some of our systems to allow for greater online and remote access. I put in there registration, vote by mail. And even though almost everything else about this presentation is about elections, I did include the need to make an upgrade to our marriage system. It's relatively small in terms of the overall cost, but it also is a reminder that we do have the entire rest of the county clerk's office and its operations that are still having to be maintained while we're dealing with these election upgrades as well. Printing, postage, and communication. You know, obviously, a lot of that is the ballots and applications and associated envelopes and notifications for vote by mail. But then there's also, you know, notifications of things like polling place changes and the new election day voting center and just general communication with voters. A lot of this is labor intensive, especially the vote by mail processing. And then I previously mentioned the election judges. And then there's temporary and overtime labor required as well. And then finally, cleaning and PPE. I know this is being touched on in other aspects of the presentation, but you know, not only for our offices and fairgrounds and the early voting locations, but 268 individual election day polling places, which, as I said, still have to be maintained and available to the public, but also have to be now cleaned and sanitized to a higher extent than perhaps had ever been contemplated previous election administrations, although will likely be the standard moving forward. So that's all for that slide. So these, in terms of the expenses I've laid out, you know, the steps we have right now, procurement and staffing, we're having to do that already. I mean, like I said, we have to, you know, make the plans. We have less than 6 months till the election. So we've put out requests for bid and information to vendors. We're putting together the, you know, internal staffing plans for what we're going to need to accommodate the vote by mail increase. We are still monitoring the legislation. You know, it seems like that can has been kicked a couple times at the federal level. So, you know, that ties into the fact that we do have a limited window to, you know, implement the actions we're going to take for November, and we cannot wait indefinitely to see if the federal government is going to provide additional election-specific funding. And then there are some long-term upgrades also needed, which we'll discuss on the next slide. So an additional consideration above and beyond the 3.5 million previously is we have been exploring the purchase and implementation of a new full voting system and or a high-speed tabulator. You know, the voting system we have right now is not very well suited to the increasing levels of vote by mail. It does not have a high-speed tabulator, so that makes the processing of vote by mail ballots very labor intensive. You know, we have, you know, gotten some information from vendors on both, you know, full voting systems. And also we have looked at, there was one vendor who, you know, had the possibility of a high-speed tabulator as an independent purchase. However, that is not certified by the State Board of Elections to be used as a separate individual item. So that would present challenges if we did try to go down that route. And obviously there would be significant challenges of trying to implement a full voting system for November. We've looked at it, we're kicking the tires on it, and we wanted to bring it to the board as you know, a scenario to consider, but also to consider the purchase being made as a COVID response, because there are real COVID benefits to upgrading the voting system. You know, even if that was not able to be implemented fully by the November election, which I think carries over to the very next slide, mentions that. So that's the overview, and happy to answer any questions anyone on the board has. And Chairman Larson, I think you're muted.
Yep, got it. I'll open it up for questions. I did have a couple questions myself before I go on to the various members' questions. So the legislation passed by the state, you referenced the past 3 elections. did they designate which elections they were referring to?
Yes, this last primary, then the consolidated election and the 2018 general election. So going back to those three elections.
Okay, so they specifically in their legislation, the state chose to disregard the last presidential election in determining as a state where these vote by mail ballots would be sent.
I can't speak to the process they use, but the end result is they selected those three specific elections, and it's our internal judgment that we would like to send it to all registered voters, not simply those specified elections.
I appreciate that because I do think we would be disenfranchising a lot of people by disregarding the people who voted in the last presidential election as opposed to the people just in the last two elections. And all the costs that you've laid out here are costs that were not part of your original budget, correct?
Correct. These are the additional incremental costs.
Okay, I'll open up to board's questions. I see Member DeCiani, the Member Covert, and then we'll keep moving on. Member Renahan.
Yes, my first question is, do you guys do a cleansing of the data for national change of address or the national deceased list with the data rolls that you guys are going to be mailing all registered voters to?
Yes, we update those, and we actually did a full voter verification mailing just in the past year, which apparently had not been done for quite a while previously. So that was one of the steps that we took shortly after merging the offices is doing the full update to the entire voting list. So yes, we are taking the steps to make sure that the voting rolls remain accurate and updated.
So what steps are those specifically?
Well, like I said, we did the full verification to the entire voting rolls, and then our registration staff, follows the state procedures for updating and maintaining those databases. And I can certainly get, if you want the actual, official processes that they use, I can get that information to you.
The reason why I ask is because the state does not mandate a national change of address clarification, and nor do they mandate a national deceased address. So my biggest concern, I have no issue mailing presidential, governor races, etc. My concern, knowing the state mandate does not require that we potentially, one, spend a lot of extra money on people that potentially aren't there, and two, because of print, postage, etc. And number two, for fraud in those areas. Those are typically the areas where we see fraud. And I naturally want to make sure we eliminate any type of potential fraud that we could be looking at. So I want to save money and I want to eliminate fraud. So those are my two concerns. I have no issue mailing governor races, presidential races. We know those people are still there and they voted. I have concerns with mailing everybody where we have not, because state mandates do not require us to do NCA or the national deceased index. My concern there is the potential spending of extra dollars and the potential risk of fraud on either side. So those are my concerns.
Well, again, and I'm happy to get you a more detailed breakdown from our registration staff of the procedures they're using and see if those address your concerns.
Thank you. Member Covert?
Hi, I actually had, before I ask Adam my question, I do have a quick question for Nick Kottmeyer. I just wanted to know, what are the parameters of the allocation of the CARES fund in terms of funding labor costs and revenue? Because I've been seeing a mixed bag right now from the different slides that we went over from different departments, and I just want to be clear on that aspect of it. So when we get to the discussion portion of our ask for our municipalities, I want to be clear and I want to make sure that we have the correct ask.
And Member Covert, great questions. I am, in a second, I'm going to actually turn over to Cheryl because she probably is the most versed in that, talking to our lobbyists. But I can tell you that the CARES Act guidance is pretty clear about what we can and we can't. Everything that we're talking about today, every single expense, although you guys, ultimately you're saying, okay, the buckets you're producing are okay, or if you want to change them, every single expense in the end that goes to the CARES Act will be vetted through the finance department and the auditor, make sure that they do qualify for every expenditure. Everything that Adam is talking about and other ones, it appears at first blush that it would be eligible for CARES Act, but obviously as we get further down the line, we would have to have more discussion and more investigation. I mean, if you want to go deeper, I mean, as far as lost revenue, no, that clearly is one of the things that is not allowed by the CARES Act. As far as the staffing time, if there's extra staffing time because of COVID, that is absolutely allowable. There's some gray areas for other staffing time, and I know Cheryl is daily getting on different calls, getting different guidance, and the guidance is changing. It absolutely is, and this will be a big topic that comes up in Cheryl's discussion later on about the municipal shares and outside assistance for the municipalities. I don't know if you wanted to do a deeper dive, we can get Cheryl on, but it will definitely be deeper in her discussion.
No, that's okay. I just had thank you, Nick. Just had a quick question for Adam. I don't know if you went over this, Adam, but how much money is the state providing towards election costs for the mandates?
No additional funding yet. I mean, that was what was discussed on the potential of the $1.2 million grant. The state was provided additional funding from the federal government, and it will be flowing down in some manner, but we don't know the details of that yet.
Okay, thank you.
All right, Member Krajewski, followed by Member Renahan, then Member Chowski, then Member Elliott.
Thanks, Adam, for the presentation. I think Nick partially answered the question. I just had a question on that Senate Bill 1853. Was that directly related to COVID, or was it just for expanding, early voting and mail-in voting? Just something that they were doing, and we've always been trying to do more over the years in early voting and mail-in voting? Or is this legislation specifically tied to COVID, therefore it meets this requirement?
You talking about the HEROES Act?
No, I'm talking about the Illinois legislation.
The Illinois legislation, because they're expanding Senate Bill 1853, requiring us to mail out, to the last 3 elections, et cetera. But is that as a result of COVID? Or is
that bill was specifically a response to COVID? There are aspects to it, for example, making Election Day a school holiday, which are in place only for this year's election because it's specifically a response to the COVID situation. So yes, so this bill was specifically the election response to the COVID pandemic. It's also not an ongoing mandate that in every election moving forward, you have to vote by mail applications to people in the last 3 elections. It's for this election, we have to mail vote by mail applications to the voters who voted in those specific elections.
Okay, that was my only question. I would say though, that I'm fine with all the expenses. If we use that as a cap, knowing that there's other buckets that may fund some of this, that, we would have, of course, if they get funded with some of those other federal bills that have some money set aside, or the state's 1.2 billion or million supposed to be allocated to us, we can then reallocate the cap that we set for the clerk.
All right, thank you, Member Renahan.
Thank you, Mr. Chairman. Thank you, Adam, for the presentation. My question is, how much is a tabulator? There was an estimate as to how much a new voting system was. I did not see how much a new tabulator might be.
So a new tabulator is relatively cheap. To get the high-speed tabulator as a standalone item is our best estimate is that's in the $100,000 range. So doing that on its own from the cost level is not significant. The bigger issue there is that you would then be blending 2 different elements of 2 different tabulation systems, which there's no state certification to do that at the moment. So we would both have to, pursue getting the state to certify that solution on an expedited basis, and also, come to our own, satisfaction that we could implement the blended tabulation system effectively. Which again, we have been actively researching that option, but those are challenges in attempting to pursue that route.
Okay, so but it's not included in which the money that you're asking for here, and neither is the new election system either.
Right. So an entire new election system, obviously, when you're looking at a scale of $5 to $15 million, that's an entirely separate consideration from the 3.5 million in the first few slides. The question of the high-speed tabulator, I mean, that's really an election vendor who is offering to sell us a whole system, also saying, well, we do have the ability to separate out this one element. So in that case, in the hypothetical scenario that we made a $100,000 purchase of the tabulator, then that would probably go in the the $3.5 billion bucket, because that would probably adjust some of the other equipment purchases that don't assume that we are making that purchase. But the voting system itself is, yes, a very separate conversation.
Okay, I mean, I think everything we've heard is this is going to be one of the biggest, mail-in elections that we've ever had, and I just want to make sure we're covered at the bare minimum levels. And also, I mean, I really think, this new election system, voting system, this, 5 to 15 million, I mean, that's a pretty wide swath there. But this is definitely one of those things that hits that sweet spot in terms of helping us with the COVID in the immediate and helping in the long term. And I really think, this is something we need to, it's hard to wrap our heads around because, what's going to happen at the state and federal level? Where's the money going to come from? But I think even at the local level, this is something we maybe need to be seriously considering. Thanks, Adam.
Thank you, Member Pachowski, followed by Member Elliott, followed by Member Zay.
Adam, if everybody gets a physical ballot, would you still request an absentee ballot?
No, it's not everyone gets a ballot, it's everyone gets an application. And then they have to return the application.
All right, and what effect will this have on early voting? Will this be sent prior to the early voting dates, or do we have a time frame when this is going to be sent?
I believe August 1st is the date that we are mandated to send it by the state. So we're sending out the applications prior to the early voting period beginning.
Now, early voting is going to have expanded hours. Is there anything else we're doing regarding early voting other than expanding the hours?
We are still exploring the possibility of additional locations. Obviously, if we can find additional good early voting locations, or we've in the past had 2 different tiers of early voting locations. So if any of those are available to be in the higher tier that offers more hours, we're certainly exploring all of those options. But again, the only one that's mandated by the state is that the hours increase.
Well, I think personally, more locations is better than expanded hours. So, let's put, I would think that's what I would want emphasis in. Thank you, Adam.
All right, thank you, Member Elliott.
Yes, Adam, I guess I'm focused on the 16.7 million of federal money that apparently is sitting in Springfield. That always makes me nervous because that money has a tendency to go sideways. Do we know what the timetable is for some decision on that? I mean, the General Assembly is not meeting anymore, right? They were only down there for about 72 hours. What's the timetable and who's making that decision?
So that decision is now out of the General Assembly's hands. It's the State Board of Elections because they were the grantee of that funding.
Okay. And do we know what their timetable is?
I know that, I watched the Zoom meeting of the last State Board of Elections meeting, and they were having, their own version of, a roundtable discussion of what, direction we want to go with granting this. And, they understand as well as anyone that, the election is coming up quickly. So if that money is going out the door, it has to be relatively soon. But I don't think we've gotten a more detailed commitment, or if we have, I haven't seen it, of exactly when that process will be decided and formalized.
Right. And as a follow-up, and I guess this is really, I guess I direct this maybe more at Cheryl, but Adam, I'd like your input too. Kind of knowing the way these things work, if we were to allocate this full 3.5 million, would Springfield then turn around and say, up, DuPage doesn't need any of the 16.7 because they've already taken care of themselves?
I certainly don't have the answer to that. I don't know if Cheryl does.
Okay, well,
Cheryl, are you there to answer that?
I can talk to her offline on that.
Unless Cheryl, you have it. All right, Member Zay.
Thank you. Thank you, Adam. You know, the first few slides were for that 3.5, right? I mean, that's what you're asking for. Like the sheriff, you've been going out and getting prices for them. It's the last slide, the additional funding and funding considerations. I would assume that's what you're talking about if we do get any federal money in. I would think that trying to put a new voting system in place with 6 months to go before a presidential election with everything going on would be just an almost impossible task. You're saying in the future, if they give us money, we'll be able to use that? Or are you thinking that if we do get federal dollars, that you'd be able to get a new voting system up and in place by November?
I'm saying it is a very, very daunting possibility. Nevertheless, we still have looked into it. I mean, we have to, cover all bases. Practically speaking, would the benefits of the new system to COVID response outweigh the risks that you point out of trying to implement it on the fly this far out? That's why it's not Plan A. However, if we were having this discussion 2 years ago about how could we best improve our system's ability to handle a pandemic and increase vote by mail, replacing the voting system would be right at the top of that list. So, if that's something that, as we've been led to believe, is allowable as a COVID response on that timeline, and if whether it's from additional federal funding or this, $161 million pool, depending how much get allocated to other sources, we did want to bring that to the board as, this is a COVID benefit expense. And, if from one of the funding pools available, the money's there for it, we wanted the board to be considering that.
Right, but you would only move forward if we got additional federal funding on this, right? I mean, right now you're just asking for 3.5. You're saying if the federal money didn't become available, then a new system would be possible then.
Either additional federal funding, or if out of the pool of $161 million, and you've allocated, to everything else, if there is available funding in that pool of money, that could also be considered as an expense out of the $161 million. It's not an expense we're asking for today, but we did want to put it out there as something that the board consider when it's looking at all of the different range of programs and projects. And also to note that there may be additional federal funding that could also be considered as well.
Okay, I mean, I'm just concerned because if you're asking for 3.5 and possibly 15, I mean, I know the elections are very important, but that would be more funding than the health department's asking for at that point. So, I mean, hopefully we'll get the federal dollars, and if we can make it work, we can make it work, but that's a pretty big ask of the department.
Sure, and again, it's not guaranteed that it's 15 at the high end. It's a range, and so depending on how serious the board was about having us explore that, then we can come back and see the specific numbers and funding sources and see if there's something that everyone agrees makes sense.
Okay, great, thank you, Ed.
All right, a couple things here. I think based upon the discussion, there is some interest in at least exploring the parameters of that. So perhaps the clerk's office could put together, Adam, some additional information regarding that, a tighter view on what the costs of that would be and what potential funding may be available. I know you were asked to put together other things for this presentation. I'm not putting you on the spot here. I'm trying to be fair, but it seems that there's some interest in that. So to the extent that you can provide in a future meeting some tighter parameters that we might have an expanded discussion on that, certainly we would welcome that. I would ask just kind of the guidance of the board, because this issue came up, the state legislature passed a more limited vote by mail the clerk's office, I think, in my view, is doing the right thing in expanding the vote by mail to all voters so that we're not disenfranchising people. Member DeCiani expressed some concern about potentially limiting that somewhat based upon clean voter rolls and whether or not we only go with the elections. Is there any objection by this board so we can provide clear guidance to the clerk's office? Does the board, the committee, support the notion of sending vote by mail ballots to all registered voters in the county? Does anyone have an objection to that? I see none, so we have clear guidance there to the clerk's office on that issue, expanding beyond what the state did, so we appreciate that. Any further discussions, questions, concerns for the clerk? All right, seeing and hearing none, thank you very much, Adam, for the presentation. We appreciate it. The next topic is the clerk of the circuit court.
So I will turn this over to Chris Katsarubis if he's on this call. Otherwise, I can't handle it. And I would like to apologize. I have the typo. They're not the clerk of the circuit clerk. So that is, I made that mistake. So Chris, I don't know if you're available on this call. If he's not, Chris and I talked quite a bit on this one, so I can cover.
Yeah, let's go ahead. And if the clerk comes in, then great.
Chairman, I'm here, present.
Got it. Okay, Chris, go ahead.
Okay, well, we were looking at, and I have two other members of my staff here for some of the more specific questions that you may have.
It's a little difficult to hear you. If you could speak up, speak closer.
Sorry, Chairman, is that better? Just working with a live mic here. Okay, is that better?
Yes.
Okay, there you are. We've kind of divided it into three categories here: IT requirements, the safety improvements for the employees, and then noticing of the defendants and related parties. I have two other members of my staff here with me for specific questions regarding the IT requirements. I have Kevin Baskey, who is the head of my IT office and division, and then I have my finance person, Julie Elvison, who can help answer any of the questions. We looked at what would be additional cost given the situation. Addison created a real problem. The village of Addison not opening and potentially permanently not opening created a problem for us because they had been a field office or a field court for us for probably 15 or 20 years at this point. So we had to make some sudden changes, and we kind of pivoted through the help of certainly the chief judge and his leadership, and brought it into the courthouse and got it up and done in a timely fashion. And may I say to the board and to Nick, and I've already praised many of the people like Mark Thomas and a few others who did an outstanding job of in a timely fashion of getting this Addison field court, such as it is, up, running, and ready to go, and met the June 8th timetable. So I really do need to say kudos go out to the staff that worked on it. From that, we were looking at potentially the new Downers Grove courtroom and those costs that may be incurred through the technical parts of it and hardware. And then also there was some question of maybe looking at potentially at Glendale Heights as in the future, or not in the distant future, in modifying our needs for a field court. So we combined all of those things into this cost, the $75,000. I did provide a description list to Nick, and Nick, if you can help me, I don't know if you provided that to the board, and so they could see kind of the breakdown we were looking at. Again, very general, very kind of open-ended at this point, but we wanted to try to give at least a good estimate so the board could review it. Is there any questions at that level?
Any questions or comments from the committee? Okay, seeing none, hearing none. Thank you.
We'll move on, Chairman. Thank you. The safety improvements for the employees due to COVID. most of you have practiced in the 18th Judicial, and you're aware that it is a wide open two-counter system, one criminal traffic, one civil. Both of those areas are about over 100 plus feet open area. At this point in time, we felt that going forward, we'd like to add to which was the aesthetic quality of the room, tempered glass. Well, tempered glass right now, and safety tempered glass is limited. We got one cost estimate that looked like it roughly at about $32,000 plus or minus. Okay, given how we wanted to set up and how it, in terms of drilling into the marble and affixing it as a permanent. We then went and said, okay, this is going to take a while for us to get it. We looked at temporary plastic partitions to protect our employees, much like you're seeing at Jewel and some of the other stores, things like that. That cost was at roughly $5,000 or so, and then overall disinfectant and supplies. So that's where the $40,000. Again, a little bit of a guess estimate involved in all of this, but this was primarily for the safety of our employees and from the general public. Chairman, if there's any questions at that point.
Any questions from the board? I don't see any.
Thank you, Chairman. I'll move on. Finally, one of our primary responsibilities as the clerk's office, along with several other thousand, it seems like, is noticing the general public as to their appearance in court. Given the executive order and the Supreme Court direction, which came down, and certainly the local orders that came out of the Chief Judge's office, multiple times we had to notice defendants, from no matter what case type it was, from felony all the way down and primarily traffic. Okay. And so those cases, and some of those cases that were just beginning to be heard at this point, were from as late as March and some of them February, that were being heard on June 8th. And due to the changes in the executive order, multiple executive orders, we had to notice them several times. There was a cost involved, not only postage, but fees and additional cost to get these notices in a timely fashion. And so that's where we anticipate that where the $75,000 arrives at.
Okay, any questions from the board as to anything presented by the clerk? All right, seeing none, hearing none, thank you very much. Appreciate it. The next topic is a fairly significant one, information technology. The committee, do you want to keep plowing forward? Do you want to take a 5-minute break? I see people nodding their heads. Member DeCiani, did you have a question?
Yeah, I was trying to get a question in on Chris Kitrubis for the county clerk, clerk of the court.
Whoever's got, if the clerk is still available, whoever's talking, there's somebody's got a lot of feedback in the background. If you could mute your mic. Go ahead, Member DeCiani.
I had a question on the area that the Addison Field Court is going into. I understand that was the area that Dr. Rossetti's office was housing for training and dealing with teachers, et cetera, for her department. Was that the case?
I can answer that, Member DeCiani. It is not the same area. It's two completely separate areas. What Mr. Katsourbis was talking about is actually down by the other traffic court. So the items are divorced from what the 18th Circuit is going to be talking about and this item.
Okay, I'll bring it up later then. Thank you.
Okay, raise your hands if you want to take a break or right now. I see several members asking. All right, let's take about a 5-minute break and then reconvene. All right.
you'll just. Be able to talk.
All right, hopefully everybody's starting to filter back in. I want to keep the process moving forward here. Again, per the Open Meetings Act requirements, if those are available can turn on their cameras so that we know they're back for the meeting, and would appreciate it. Looks like we at least have a quorum of people available to continue. So if we could move to the next portion of the discussion, which is with respect to information technology.
So the next portion of this presentation will be done by Don Carlson. Don has reached out to all the different departments and electives to try to encapsulate a lot of the overall IT needs left in the county. And so he's going to be speaking for a number of different departments. So I'll turn it over to Don.
Good morning. Everybody hear me okay?
Yes.
Perfect. What we're talking about this morning are generally systems and items that pertain to additional hardware and software to allow for increased number of remote workers, and requests from departments for hardware and software to meet additional social distancing and remote workforce needs. The total request, funding request is $2,680,000. Next slide, please. For the IT portion of the ask, we're looking at a number of different pieces. Multi-factor authentication is a piece that we're using for security that we've actually already procured, brought through the board, and is being implemented. Video conferencing in conference rooms, A and B, and the county board meeting room are done. That was a procurement that went through the board as well. Additional laptops and related hardware for departments and for remote workers this is on top of the original couple of orders that we placed right when the pandemic started. So this gets us to a more optimal level. There's still some more laptops we could probably do, but this gets us to a comfortable level. We're also looking to replace the infrastructure for our virtual environment. Those are servers and storage for remote workers. And those applications that we're talking about here are very important applications. They're the client server versions of our real estate tax application, the election registration database, the ERP system. So these are big, important systems. We're also looking to increase our ability for users to access our network from home without county laptops. That's one of the reasons why we're able to have an ask with less actual laptops than we maybe could have. And then we're looking at the digital signature software piece, which is similar to DocuSign if you've used it. It's the Adobe product, and that will allow for remote signatures on a number of different documents that we use. Next slide, please. For community services, they're looking at a tenant-based rental system. They're also looking at a queue management system. That system is in place actually at the court today. So those of you that have been in the 18th judicial know or have seen that queue system, it's very good and allows for, as we state, touchless check-in, increased social distancing in the waiting room, and then some room monitoring system for the family center. Next slide, please. Care center request, we're talking about iPads for FaceTime communication between residents and loved ones, software to create online training materials for staff to view online or on mobile devices. Obviously, that's critical when you have a lot of remote work. And then software to send mass emails, calls, texts to residents, families, volunteers. Next slide. For HR, we're talking about an e-recruiting application. This will allow for an electronic version of the way we recruit today and onboard, so that, for example, recruiting materials can be sent around electronically, reviewed, signed off on, and all with less contact between candidates, employees, and staff. Next slide, please. The public defender is looking for a Zoom room to allow for virtual defendants with virtual visits with defendants, and the state and also some scanners to digitize records. The state's attorney is also looking for some scanners to digitize records for remote access. Next slide. I think that might be the end of it. It is. Any questions, comments?
Any questions or comments from the board? All right, seeing none, hearing none, obviously IT requirements are very high priority, so I think we have support for that. We'll deal with those on an individual procurement level basis as the expenses come in. Thank you. The next topic then is the 18th Judicial Circuit Court.
All right, so this next one, I think we have representatives from both the state's attorney's office as well as the chief judge's office. They have two completely separate asks, obviously one for the jury trial component, and then the other one with the technology and all the existing courtrooms. But with that, I'm not sure if State Attorney Berlin, if you're on, or Chief Judge Guerin, if you're on.
Yeah, you're on.
Yes.
This is the This is Chief Judge Guerin. Can you hear me?
Yes.
All right. Thank you, Chairman Larson. Thank you also to the county board for giving me an opportunity to discuss this. I sent a letter to the board outlining the basic challenge that we face and a possible solution to it. But just to reiterate, it is the greatest challenge we have right now for the judiciary is in moving forward is holding these jury trials in a safe and healthy setting. So the Illinois Supreme Court has continued or authorized all the chief judges to continue these jury trials because of the problems all the circuits are having with the social distancing and so forth, trying to get a jury impaneled. It's been really impossible. And there's only been a couple circuits that have just started to do it now. DuPage County, the 18th is, the criminal trials are out until July 20th. The civil trials I've set out until August 24th and probably going to push those later. So the Supreme Court's issued these orders. There's been legal challenges filed to these orders. So they're really somewhat in question. And the problem we have is really the felony in custody cases and some misdemeanor in custody cases, mainly domestic violence cases that get set for trial at a great rate. And they have statutory and constitutional speedy trial rights and victims' rights. And it's really imperative we have a means to start trying these cases. So what we have been working on since about March or April, after we got the initial problems worked out in the courthouse, is finding existing courtrooms first to do these in. And as I said, like all the other circuits in the state, we really only found one courtroom that could possibly accommodate a socially distant jury. It's our largest courtroom. And as I said, we have to make a lot of alterations to it. It's not ideal. Jurors would be scattered throughout the courtroom. The witness stand is too close to the jurors, so on and so forth. The deliberation rooms are all too small. It's really amazing when you start spacing these things out with 6-foot distancing, how little room you're left with. I've had 110 seat courtrooms in some of these places. I can get 32 people in once I socially distance. And the jury deliberation rooms, which are normally fine, obviously, for 12 people, once you get 6 in there, it's a real problem. So we ran into this issue. We have courtroom 4000 that we are going to use as best we can. Facilities has done a great job giving me some sketches as to how we can possibly do that. Again, not ideal, but we can do it. But we really need a designed courtroom going forward. As best we can all tell, this is going to last for a while. And, DuPage County residents are our jurors. They're coming in from all over the county. And I think it's very important that DuPage residents feel safe and comfortable and know that we've done everything we can to provide for them when they come in to hear a jury trial. So the proposal is to create this courtroom as we've sketched out in the 3rd floor of the courthouse. And the advantage of it is that the jury box can be properly 6-foot distanced. The witness chair can be a proper distance. Counsel tables can be in a proper distance, and the jury deliberation room is available. And I just want to point out, when we initially studied this, the regional office did not really come into play. My understanding was we could do it without affecting them at all. And then as the space was reviewed, we realized really the jury deliberation room was the main problem. We needed a bigger space. And that's when, maybe last week, sketches were presented where one of the conference rooms in the ROE would be the jury deliberation room, which is right across the hall from where we would put this courtroom. Right now, the grand jury is functioning in the other conference room because we can't get the grand jury in the regular grand jury room. So the ROE conference rooms really cannot be used through the end of the year based on, our use of the grand jury room and based on not being able to have large meetings anyway. But that's where the ROE came into play. It really was not contemplated until very late. And so the issue really for the witnesses and the victims and the defendants to try to help alleviate, I think, is beginning to be a serious backlog of in custody cases. We don't want to have appeals on these. We don't want to release those accused of violent crimes because we have a speedy trial problem. I think we have to have a courtroom ready to go to accommodate these needs. And I'd be happy to try to answer any questions you may have, but that's really the challenge that we're facing and the reason for the proposal at this time.
Before I open it up to questions, if the state's attorney wants to add anything to the chief judge's presentation on this issue, let's hear from the state's attorney, and then we'll open it up to the board's questions.
Thank you, Mr. Chairman. No, I would just agree with everything that Judge Guerin just said. We have discussed this along with Public Defender York, and we all agree that this is really a priority and a huge need.
Okay, I'll open up to questions. I see members A, member Elliott, member Eckhoff, and we'll continue from there.
Thank you, Mr. Chairman. I know we heard in public comment today, and I got a phone call last night from our regional superintendent of schools who was very upset that nobody from these offices could contact her about displacing her office. I don't understand that at this point, why they were not given a heads up that we're basically going to move your area and bring it somewhere else. I mean, I just find it hard to believe. I know the courts have been closed, that with all the courtrooms we have, that we cannot combine other courtrooms and find the space that we need to do this without spending $3.5 million. With the numerous courtrooms we have, I mean, I think they're set up to be combined. I'm sure that has, the chief judge or the state's attorney talked to our facilities people about combining other courtrooms and getting these ready.
Yes, as I say, our first goal was to look at current courtrooms and not have to build anything. We cannot combine courtrooms without tearing down walls. And I mean, I think it would be a massive project. My understanding from facilities that it's not practical. It's this one courtroom that was the one that was most likely the one that it could get done. And that's, as I said, that's the same problem other circuits have run into. They have basically one courtroom, maybe two, that they can do these juries in. And we're faced with the same problem. As far as Dr. Rossetti's office, as I said, her offices over there, I did not contemplate having to do anything with ROE. And it was only at very late that I realized the jury deliberation room, at least one would have to go over there. Now, the sketch was for two, a jury deliberation room for the courtroom 4000 and a jury deliberation room for a new courtroom. And I'm certainly willing to work in cooperation with Dr. Rossetti. I want to have all of her input on this. My understanding was that facilities had communication with her on this. That was my understanding, and perhaps that didn't occur. I'm not sure why, but as I said, her part of this, the ROE offices were really not contemplated until the very last minute here. So.
Well, I think out of a common courtesy for a countywide elected official that you would contact them about relocating part of their office. And my other question is, how many jury trials have we had since March?
0. We can't have them. That's
so
the
you
problem.
can't retrofit your courtroom. 4,000 or 400.
4,000, as I said, is the one courtroom I'm trying to retrofit to handle juries, but it would be one courtroom.
And how many do, in normal circumstances, how many do you do a week?
Well, I can just tell you, I have the statistics for the year. I mean, for example, in 2018, we did 116 juries. In 2019, we did 106. I'm focused on in custody matters right now because those are our problem with the speedy trial. So I think we have through September, I want to say, members A, maybe 50, maybe a little more pending in custody jury trials. And, as you can imagine, one at a time in one courtroom, and then I have to change the call from that courtroom to somebody else. Doubling up court calls normally is not a problem, but in COVID with social distancing, it's extremely difficult to have 2 calls in one courtroom. So.
Okay, thank you.
Member Elliott, then Member Eckhoff, then Member Chapman.
So I just want to say that I echo a lot of the frustration I hear in Member Zay's voice. And I don't want to beat the horse to death, but I will say that this appears to be, this proposal didn't come together yesterday. My understanding is that Ms. Rossetti heard about it last night. And I don't think, Chief Judge Guerin, respectfully, that either you or State's Attorney Berlin or Public Defender York would tolerate it for a moment if you were advised the night before a board meeting that there was a proposal that was going to disrupt a part of your operations. I don't think you would be very happy about that either. So I understand her great frustration at not being invited to participate in these discussions. I 100% understand her frustration on that. When I look at this proposal, I look at the second part, which is the outfitting of the courtrooms with technology to allow remote viewing. That feels to me like we're going to need that going forward no matter what. I mean, that's I think just sort of the wave of the future. I do wonder though about this first one. I understand that in the short term, we have to do this, right? I get that. But I wonder what the long-term implications of this are. Do we anticipate that we're going to need a socially distancing jury deliberation room 3 years from now, 5 years from now, 7 years from now? And I'm just wondering if there's a different way that we can accomplish this first item without the 3.5 million.
Well, these requests they're difficult to make because we're all operating in a situation where we don't really know what we're going to be facing. And I would just point out, Member Elliott, that I did make repeated inquiries as to whether Dr. Rossetti was informed of this. And I was told that communication was taking place or would take place. I wished I had just picked up the phone myself like I usually do, but I was trying to honor the process that was going on. But I want to let you know, I asked what her position is going to be if we have to affect the ROE. I asked it more than once. So
I respect that, and I accept that, Chief Judge.
Yeah. To answer your question, I think that the concern here is that if we don't get these juries up and running in more than one courtroom, we're going to run into a speedy trial issue that, as I said, the remedy is often to let the defendants out on bail. And, you're really talking about some serious cases that we've got in the pipeline. So I wish I could do it in some other way that Member Zay suggested, if I could combine courtrooms or something. We looked at that, but it's really not feasible, and maybe facilities can answer that question even better than I can, but it's really the one courtroom I've got right now.
Does this 3.5, does this envision any and all relocation expenses for the ROE to the annex? And the annex is next door, right? That's the building that the state's attorney's office is in?
Right.
Okay.
No, I believe that
those expenses?
The annex, my understanding is it's sort of an empty shell room. So there's expenses to get that up and running with plumbing and electricity and things that's separate from the courtroom.
Okay, I'm not certain. My question is the $3.5 million, whatever the costs are to relocate the ROE, the outfitting of those rooms over there, the moving expenses of their equipment, whatever, is that included in the 3.5 million?
No,
Okay, so where is it anticipated the ROE is going to come up with that money then?
no, my understanding was there's an additional cost to get the 503 annex. Now, maybe,
Judge Guerin, I can handle that. The 3.5 million is our estimate, and I will tell you, it is a very quick estimate. It includes all of the relocation expenses as well.
Okay.
So that is all in expense with our best estimate right now.
Okay, thank you.
All right, Member Eckhoff, then Member DeCiani, then Member Chaplin, then Member Desart.
Okay, I guess my first question is, we seem to be in phase 3 now, and hopefully we're going to get to phase 5 at some point. Do the modifications that you need to make, are they based on phase 3 restrictions or phase 5 restrictions? Because I'm assuming we could put a lot more people in a room with masks under phase 5, which hopefully is going to be occurring at the beginning of August.
well, I'm not, I'm trying to go by what the CDC recommendations are and what we anticipate they're still going to be by the time this gets constructed. So the phases, I'm not sure, Mr. Eckhoff, where we're going to be when, but I think my opinion is, and I think Mr. Berlin and York's opinion is, we're still going to have 6-foot distancing for the long-term foreseeable future.
I guess if we can have the health department maybe give us some information on that, because I hate to set up things that are so restrictive. They're based on restrictions that are in place now, and then all of a sudden they come off in August or are reduced, and we could use existing courtrooms based on the newer restrictions. The second thing is, and I've been texting Suzanne all back and forth all morning, but she's saying the annex will not work. We can't set up the 4th floor of the annex. I thought it was vacant, but I thought that there was electrical and plumbing put in at the time we built it, because someday we thought we would need to use it. I understand the problem with putting criminal defendants over there, because you got to walk them all the way through, but it's not a possibility to set up 2 or 3 civil jury trial courtrooms that would then maybe free up some of the civil ones to turn into criminal on the 2nd floor.
Well, there are a lot of issues with the 503, as you said, our focus being the in custody criminal cases that we've got to get unjammed. We can't get inmates over there. It's not a secure situation. We can't really use the civil courtrooms either, because they're way too small in the courthouse to accommodate these. There are 0 courtrooms, as you can imagine, that were built to be socially distant because nobody ever heard the word when they were built. So, I have 0 courtrooms that can accommodate this kind of a trial, other than that one, 4,000.
And then in the screen that the presentation was based on is gone, but I thought that it said the 3.5 million is to retrofit all courtrooms. And I'm assuming to try and get this backlog done as quickly as possible we could just do 3 or 4 and get hopefully the logjam eliminated. Because
There's 2 separate issues there, remember.
Yeah.
3.5 million is for modifications for jury trial compliance. The second, the $2.75 million, and you see in the slide, is for retrofitting all courtrooms with technology.
Right.
All right. I was hoping that we didn't have to do all courtrooms, I guess, to keep the cost down, because, I know there's a backlog, and I know that we want to give everybody an opportunity to have their trial without speedy trial violations. But I just figure once things settle down, then, and I know some of the judges, at least on the 2nd floor, switch courtrooms when one's got a jury trial and the other one doesn't. Sometimes they use 2014 or something like that. But I would really like to look at and try and deal with what the actual restrictions are going to be at the time that we get these modifications done. So hopefully that might give us some more flexibility. But I know the judiciary is in a tough spot with this. And,
Well, I mean, your point is well taken. I share the difficulty of knowing, what's coming in the future as far as whether things are going to be calmed down and then we don't need this. But I guess we just have to work with the situation as it is now. And the real problem is 12-person juries, just to be specific. I can handle 6-person juries, which sometimes are held because you can do 6 persons in my deliberation rooms and my courtrooms now. That's not a problem. But 12 persons with 2 alternates, typically 14 people, is what the issue becomes. And if you have a murder trial, and I know there's several set, sometimes they last weeks.
Right.
Or asking DuPage residents to be in a confined space next to each other for weeks at a time, listening to a murder trial. I think that they should have the proper setting to do that. 4,000 we can make it work, but it is going to be an odd situation. It's going to detract from the general decorum of a courtroom. I don't know what effect that will have on jurors. They'll probably adapt, but when you have alternate jurors sitting in the public gallery section, some jurors sitting actually in the well of the courtroom, it's not the way it should be, certainly. And I think it affects trials. So.
All right. Well, thanks for all your hard work.
Okay, we still have several more people wanting to comment. I just did have a question, follow up to that myself. Has the Illinois Supreme Court provided guidance on the use, for instance, of technology to handle trials so that you can do distancing through technology as opposed to physical presence?
They have issued some guidelines on that, Mr. Chairman, and we are able to do a lot by remote proceedings. In fact, the civil division kind of was able to turn on a dime very quickly and start all these remote proceedings. We've been doing regular calls since May by Zoom and other video conferencing. When you get to the criminal side, a lot of things possibly can be done by Zoom, but when you have confrontation rights, the Sixth Amendment's confrontation rights, if the defense objects to the use of a Zoom or other kind of remote proceeding, you're setting yourself up for an automatic appeal and probably going to lose it if you don't provide a defendant the right to personally confront the witnesses against him or her.
And I understand the right to confront a witness concern. That's I forget which amendment to the Constitution. Off the top of my head, I don't do the criminal side. But in terms of the ability to place a jury remotely so that they can view the trial proceedings without being physically in the room, I know that creates some logistical problems, but has the U.S. Supreme Court is taking arguments by Zoom. The Illinois Supreme Court is doing so. Has there been guidance provided in terms of the ability to do that in a constitutionally acceptable manner? And for instance, we could put jurors down in the cafeteria, to deliberate if need be, unless the cafeteria is going to be reopened and used.
Well, I think the U.S. Supreme Court and Illinois Supreme Court can conduct their operations that way because they're not witnesses testifying. Those are legal arguments to the court with just lawyers. When you have witnesses testifying, the jury has to assess their credibility, has to see them, the defendant has to see them. So my understanding is there's real concern with conducting a criminal trial via remote proceedings, that they have not, the Illinois Supreme Court has not come out with anything that says you can go ahead and do that. I would think it's the opposite. And I'd let Mr. Berlin or Mr. York comment on it further from their perspective, but I don't think you can do it in that criminal setting.
Yeah, so jurors are instructed that they're to decide the credibility of a witness. And when they do so, they have to consider a witness's demeanor, manner while testifying, facial expressions. That cannot be done via Zoom or closed circuit TV. They have to be able to view a witness's testimony in person. And again, criminal trials are different because a person's liberty is at stake. So I don't see the Illinois Supreme Court or the US Supreme Court ever allowing Zoom hearings for criminal trials with a jury.
I would agree with everything Bob said. This is Jeff York. I also think it's important for the board members to understand that this courtroom is set up that masks may not have to be worn by both the jurors and the witnesses, because as a lawyer, you need to assess both the jurors' reactions to evidence and arguments, and especially the witnesses' credibility can't be judged with a mask on. And so I think that's why the distance is required. I can tell you from my perspective, if courtroom 4000 is used for a 12-person jury, and it is a case with 2 of my lawyers and an interpreter, that I don't know how physically we can be distanced enough in the well of the courtroom. I've seen kind of the sketch and the layout. So there'd be 4 people on the defense team. That's going to require at least 2 tables. And what I don't want is jurors behind me. I think that that's going to leave us open, frankly, for an appeal issue. That's not really my concern. It would benefit my client, I guess, if it comes back on appeal. But I also don't want my lawyers being found ineffective. So we will be objecting. We'll have to object to some of the ways that we're going to try to incorporate a jury trial in a way that isn't normal. I do think it could be problematic down the road. And frankly, 1 room won't be enough. Last year, my office alone did 42 jury trials. That's more than 1 a week, because not every week is a jury week. And there is a backlog, and it's all of the things, like even approaching a witness is now a more difficult task. If you're going to bring a piece of paper to show a witness and impeach them, it's a completely different scenario now with COVID than it was before.
I appreciate your thoughts. One of the suggestions, by the way, is we can appropriate the money, but ask for a more detailed plan. We're not voting on this plan today. We're setting aside resources that can be a way to figure this out. All right, we have several people wanting to talk. Member DeCiani, followed by Member Chapham, then Member DeSart, and then Member Tortori.
Thank you, Chairman. A little challenge. I'm a little challenged by the lack of communication. I think Dr. Rossetti should have been given a heads up. That's challenging. I'm also challenged. Did we just spend quite a bit of money on relocating her offices to this site? So was it like almost like $600,000 to build those? I know it was a lot of money. I remember voting on it. So we spent, I think, like close to $700,000, and now we're gonna basically take the $700,000 that we spent, reconvert everything. It just seems like there should be a easier, more efficient way to do this without throwing this thing up for grabs. Could we work anything out with the other courthouses? Like what, I mean, maybe it's time to relook at Woodridge and, looking at what we're spending here. In the past, it was like, no problem, we can handle everything. And now we're like backpedaling and spending millions. And we've already spent, a lot of money to build, Dr. Rossetti's offices here. So my concern is that, are we throwing good money after good money? And is there other options? Can we maybe try to work things out with field courts to not have this pressure? Is it all been looked at?
Are you, Member DeCiani, do you mean, should I look at field courts to hold jury trials?
No, I'm just wondering, is having Addison and Downers Grove come in, is this causing the problem, or would we have had the problem regardless?
No, that has nothing to do with it. We would have the problem regardless, just because the nature of the courtrooms. As I said, even our largest courtroom, which is 4,000, socially distanced public gallery is about 27 people I can get in there. And all the other courtrooms are significantly smaller. So the traffic courts really have didn't affect this part of it. This is just 12-person juries are a real challenge and a real important part of the whole judicial system, as I'm sure everybody understands.
Okay, thank you, Member Chaplin.
I noticed.
I'm sorry, Member DeCiani, did you have another question?
Yeah, when maybe make sense to use our auditorium as a temporary solution, so knowing that COVID will be gone in a year and hopefully we can get back to normal without spending 3.5 million?
Actually, I believe that was looked at. And I actually looked at putting jurors in the public gallery section so that I wouldn't have this compression of the jury box problem. And that's what we would do over in the auditorium. And I know Jeff York took a look at that specifically. The issue became, by the time you separated them, you have to skip a row of seats to get the 6-foot distancing. And I went in and took a look. The last jurors were so far back in the public gallery, they were so far away from the witness stand and from what the judge was saying up at the bench that it was very, I don't think you could do it. The witnesses would be way too far away from what was being testified about and being able to see the witness in a proper manner. So I think that would be the auditorium too, Member DeCiani. I think that would be your issue, that people would just be too far away from the testimony and the evidence and the exhibits. And then if you have the public accommodated, the public ended up sitting behind the jury when they were in the gallery. And I really can't have that, because you could have a member of the public say something, you know, and the juror is sitting right in front of them. So believe me, we examined all these issues. I didn't run out and just say, I want to take over the 3rd floor. And I wouldn't propose it unless I had examined every alternative so far. But, and I'm more than willing to keep looking at it and work with Dr. Rossetti. Maybe there's a way that we can get this done that doesn't take so much of her space. But, you know, we're using the grand jury as in one of her conference rooms. She's not able to use the space through the end of the year anyway. And the space that we've contemplated arguably is much better and nicer than where she is. So aside from the communication issue, which I acknowledge and I agree and I regret having happened, the physical space may end up being better.
Okay, Member
I
Chapman.
appreciate, I was going to explore all options. Thank you.
Member
Thank
Chapman.
you so much. Thank you so much, Chairman. So, and thank you, Judge Gruen, for being here today and for giving us the nice detailed presentation. I know sometimes communication errors happen, but my experience with you has been very good, and you've always been probably one of the most communicative people with us. So, you know, you're very good at that, and I'm sure it was just not intentional or anything. So this extra courtroom, I know we're talking a lot about, you know, COVID's going to be gone. I think this courtroom is a really excellent idea because, you know, I think we can leave this social distancing courtroom here, maybe even after COVID's gone. You know, sometimes we have very bad flu seasons where people might want to, where you could social distance. So, you know, people die from the flu all the time. What we're hearing from medical experts is this is the first of probably more pandemics coming down the line. I think it's great that we will have a courtroom where people can social distance. And if we have another pandemic or a variation of this COVID-19, I think, you know, this courtroom could serve purposes, other purposes for years down the road. I think it's a good idea. I think you're being proactive. I think we need to prioritize, you know, I'm just going to say, I think getting people speedy trials and having our courts up and running is very important. And I'm not sure, I think the regional superintendents use this for training purposes, if I'm not correct. And I think those would be much easier to move than moving our whole court system. So I think there's a lot of benefits to this. Like I said, I think it's great to be proactive. And if we, you know, I mean, I don't know that we necessarily have to disassemble this because I think it could be used for other illnesses and possible future pandemics.
Yes, Member Chaplin, I thank you. And I would agree absolutely that it would be used for the future. And I think, you know, it would be really a leadership role for DuPage to do it, because I'm telling you, all the other circuits are really up against it with trying to figure out how to get this done. And, you know, they're trying to You have to select a jury too. You need a large space to select the jury and then get the jury impaneled. There's just many challenges involved, and having a courtroom like this would be certainly a unique situation. Would show leadership from DuPage once again.
Okay, thank you. Member Desart, then Member Renahan, then Member Tonatori, then Member Ozog, then Member Elliott, then Member Zay. We're going around the room, so go ahead.
Member Kaplan kind of stole my thunder, but I absolutely agree with the Chief Judge with regard to clearing these cases in a timely manner. I think we owe it to our residents to get a speedy trial. Wondering if the employees in the ROE are working remotely anyway, and referencing the ROE, I think this is a global pandemic and we have all had to make sacrifices. So I am totally for this. My question was, once these accommodations are made, will this courtroom become a permanent fixture? And that question seems to have been asked and answered. So thank you.
All right, thank you, Member Desart. Member Renahan.
Thank you, Chairman. And I'd like to thank Chief Judge and State's Attorney Berlin and Public Defender York on weighing in here, because I think what you're doing is upholding the integrity of our judicial system, which is so important. My question is probably more for Nick, though. In terms of how do we get to 3.5 million, we had discussions ad nauseum on field courts, and I think it was about the neighborhood of $500,000 to scoop out part of the part of the third floor for field courts. How do we get to 7 times that for doing this socially distanced court?
The 3.5 million is, I mean, you got to realize from Friday till now is the estimate, but the courtroom that we're talking about here, a grand jury courtroom, is a completely different type of construction than a traffic court. The federal regulations for that, ceiling height, everything in there, the bench, the jury box, it is completely different. And obviously, as we move forward, this is a space saver number, and we would get hard estimates, hard bids on the construction. But this is the best that we can do based upon the time frame we had for providing the county board numbers.
Okay, I just want to point that out, because we talked ad nauseum and we talk about data and everything that we need to, in order to spend money. And I just question what 3.5, how we got.
I absolutely understand, but with given 2-3 days to come up with an estimate for courtroom build out, we had the best. We had everybody trying to work on an estimate, and this would be a space saver if approved by the board, a space saver only. And then as we move forward with all the components, now keep in mind too, as I mentioned before, not only is this the courtroom, but this is the jury deliberation room. This is the relocating ROE. So there is a number of components to this project that do complicate it greatly.
Okay, thanks, Nick.
And Member Tonatori.
Thank you, Mr. Chairman. I too received the phone call from Dr. Rossetti last night, who was very frustrated and about the lack of communication. But knowing State's Attorney Berlin and Public Defender York and Judge Guerin, as I do, I'm sure that this was not something that was done deliberately, and certainly not something that was overlooked by them. I think this is a staff problem, quite frankly. I don't know if it's our staff, the staffs of some of the other people, but could be just a part of the left hand not knowing what the right hand is doing. Notwithstanding that, anybody who's ever been involved in as a juror or as a lawyer knows that juries are unique. There's certain things that you need. Being in the same room is imperative to get a fair trial for a defendant. The suggestion that we could do any of these trials in a field court is just off the charts, simply because there's never going to be a village hall that's going to want to take a jury trial and a murder trial in their village hall. It's got to stay in the courthouse. That being said, harken back a couple of years ago, I might have been one of the people who voted against putting the ROE in the courthouse. And the reason is that I always thought a courthouse should be for court-related activities and not educational. However, we were told then by Chairman Healy and his committee that this was the best place for it. We believed him. It got done. And other than a pandemic, we probably wouldn't be having this conversation. Ultimately, I think it's best to keep and do what the Chief Judge is suggesting here, Although I acknowledge that it's a difficult position for Dr. Rossetti and her people to be moved again or moved. But my concern is moving them to the annex or moving them to a place that may not be a permanent home for them either. The annex is associated with the courthouse. It's between the courthouse and the state's attorney's office and the probation department. It's all court related. It's not necessarily education related. So if we're going to do this and we're going to move her people and retrofit wherever she's going to go with her people, my suggestion to you, Nick, is let's find a place that she can be comfortable with and the ROE knows is going to be there for the future, and not have to be concerned about whether or not we're going to get more cases or less cases or otherwise be tied into the court system. Simply, it's terribly important that they have a place to go, whether it's on our county campus. We've got plenty of room on the county campus. Presumably we can find a place for them to be there and not necessarily be disrupted again. But again, I'm sure that this was a miscommunication among staff somewhere, all well intended, I'm sure, but nonetheless, I understand Dr. Rossetti's frustration, and I also understand the Chief Judge when he says that he certainly didn't mean to do this, or this wasn't done in any deliberate fashion. Thank you.
Oh, sorry. Is anyone from the ROE here to comment?
I'm showing that Darlene's actually on the call, Chairman.
Regional Superintendent, did you want to comment on any of these issues that have been raised? We want to give you an opportunity to speak as well.
Well, thank you. I do appreciate it. And I do appreciate everyone's comments, and I really do. Thank you very much. I was totally blindsided, and I don't know what you know about the Regional Office of Education. In order for every teacher to renew their license, they are required to take training from the Regional Office of Education. And so this is a big year for licensure, so we do a lot of training, okay? We do plan on opening up our site in July. I have had staff there throughout the summer. We still do. We did a lot of Zoom trainings. We did a lot of things like that, you know, with our staff. So we have been working, you know, but we do have staff there, at least one staff member there every day. We have been working with the Chief Judge's office and assisting them. They have been using that site where we are not, you know, present right now. And I absolutely understand the needs of you know, the safety needs and the critical role of you know, that the courts play. I'm in a similar situation because I'm working with all of our school districts, public and private, to make sure that our children have safety and social distancing when we go back to school. Very concerned about this as well. You know, my perspective was very much from a more of the taxpayer point here. You know what? We have a 4-year lease that we have engaged with the county. You all signed it. The Chairman Cronin signed that lease. We have been paying $140,000 per year. The lease is up in 2021. We have verbally a commitment to renew that lease and then pay rent. You know, so that's why, again, I thought this was, you know, it was just, you know, kind of rather like, you know, just kind of unsettling, you know, as well. And I know we're in very unsettling times. I know everybody needs what they need to do. And I'm certainly not opposed to working with, you know, with the Chief Judge on all of this. And I really appreciated Board Member Tornatore's comments about, you know what, it's just that stability and just that, in, you know, that the role that we do play, which is a statutory responsibility of mine to, you know, provide this service, you know, to our schools. So I don't know if anyone has any questions of me.
I'm going to keep going around the room. The questions may come up along the way. Member Ozog, followed by Member Elliott, then Zay, then Healy, then Selman.
Thank you, Mr. Chairman. I just want to reiterate or reestablish, I'm looking at the number 1, modifications required. The plan would create, move vacant annex space, ROE, conference rooms, relocation of adult protective services, relocation of probation bookkeeping, creation of 2 bathrooms. And as we learned from the Downers Grove Field Court, bathrooms are expensive. But my question is, and perhaps this is a question for Nick primarily, have other alternatives been looked into across the entire county campus? For instance, our boardrooms have been modified for video meetings for Zoom. The ROE conference and training could occur in there. What sort of umbrella facilities management do we have where we have a record of this meeting is being held there, a calendar, I guess, where other groups could utilize the county areas as much as possible? And the other question I have, was it looked into, and also, I also want to backtrack a bit. I want to thank Judge Guerin for the work that his office is doing. And I'm sure that it's unfortunate about the miscommunication or the lack of communication between the ROE. Everybody is working seat of their pants. These are extraordinary times, and we all have to be very tolerant and forgiving when things like these do happen. But my main question is, in terms of facilities, would it be possible for adult protective services, for instance, to be located somewhere else on the campus? Probation bookkeeping. I know it's not optimal, but perhaps we're only talking about maybe hopefully 12 to 18 months, something along those lines. And I'd also like to see, I don't know what the usage is on our 2 conference rooms, but I believe, is there a divider, Nick? If there is, that would make a larger room. And also it would facilitate Zoom conferencing, which I think we're going to be doing for at least the next 12 months pretty regularly. We don't really know where this is going, which is one of the most difficult things in holding a discussion like we're having today. So Nick, if you could talk about utilizing the entire campus for these kind of things, that might be something to reduce that $3.5 million tax or number here. Thank you.
Okay, there were, I think, about 12 questions in there, so I'm going to try to go through. So as far as moving some of the functions over in the courthouse, I think that the chief judge or state's attorney or public defender York can say more. Separating those functions from the court functions is probably, I would venture to guess, a no-go from that. And even if we do temporarily relocate them, the problem is if we build this courtroom, the social distancing, they are permanently, they're permanently displaced. So we need to find a permanent home for them. And so wherever they go, they would be out of that area, obviously forever, if we build this courtroom.
In the courthouse, yes.
Yeah, in the courthouse, right. As far as, can the ROE use other space across the county? Absolutely, they could. But the problem is they do have very large gatherings, very large training. And that magnitude that they're talking about is probably only available in the auditorium here. And then we looked at that before. I know member Healy was very involved in that before. We've looked at that. Can they go other places? And for some of the smaller events, they can. But that was the whole purpose of the lease that they had, is to have dedicated, reliable locations. Now, I know that there was maybe a question a while back. We do have a lease with them, but the chief judge does have the ability, as we wrote that, to break that lease, but they must be relocated. The ROE must be relocated as part of that. So that this plan does accomplish that. Does that cover most of the questions, or what?
It does. I would just like to point out, in my own personal experience, I've actually taken class or a training session from the ROE years ago, but it was off-site. So I think what I'm trying to get at here is the looking at expediency for the time frame that we are looking at, 6 to 12 months. But you've answered my questions for the immediate present. Thank you.
A little bit. I do want to talk a little bit about communication, because although I was not the one talking regarding this plan, I can tell you that this plan developed kind of into where it's at, like our Monday afternoon. I mean, it started talking about Friday, but Monday afternoon, and it was like, and I apologize that she wasn't notified. I personally called Darlene last night, but it really wasn't developed until mid-afternoon, late afternoon on Monday.
Meaning yesterday.
Right now.
Monday meeting yesterday.
Yeah, Monday being yesterday.
Yeah, and we understand this is all being done on the fly. There's a lot to this. Again, just to remind the committee, and there's several other people who still want to talk. We're looking at a placeholder for this funding. We're not committing to spending $3.5 million. This was an issue that literally came up over the weekend and was presented to us as a more formal proposal yesterday. I'm going to continue to let everybody talk to this issue, but I obviously have to bring this back when there's more time for the staff to coordinate and process options available, including what everybody has brought to the table, and try to figure out a cost-effective means of doing this that respects everybody's time and meets the constitutional requirements we have. But we do have some constitutional requirements that are going to be problematic that they're trying to address. So with that, I'll move on to Member Elliott, then Member Zay, then Member Healy, then Member Selman.
So my question is really directed at Dr. Rossetti, and I'm hoping that she's still on.
She is.
My question is just this: are you amenable to working with Mr. Kottmeyer and Chief Judge Guerin and State's Attorney Berlin to, I guess, tour this space in the annex and figure out whether that would accommodate your needs? It sounds like the $3.5 million budget would envision those relocation expenses. So I gather that any relocation expense would not come out of the ROE budget. I think that's what I'm hearing. And so with that, I'm wondering if you'd be willing to work with them going forward to make this change.
Yes, absolutely. And I think I said that, Member Elliott. It's just, again, it's that stability piece. This is a statutory responsibility of mine. I know the importance of quality education in DuPage County for the good of for the county as well too. So I take my responsibilities very seriously, but I'm happy to continue to work and have always said so to everyone I talked to last night. But I just, again, it was just needed to know more information. And so I'm glad I'm on this call today. So thank you.
Thank you.
Thank you, Member Zay.
Yeah, I mean, I'm starting to get concerned that, we heard from the public defender. I remember it took us several months to build the ROE build out. Now we're talking about putting a courthouse in, and they're talking about speedy trials. I mean, again, my concern is, A, can we get this done in a speedy time? I'll have to ask Nick that. And by the way, while we're doing this, now it looks like we're going to have hundreds of workers in our courthouse and our annex and everywhere else. Where's the health issues then for our employees that are there every day? I mean, can we even build this in a speedy time? I mean, I would think of this when you're talking, Nick was saying about specifications and everything else, it's going to take 2 or 3 months at least to build this. I have no idea. Nick, if you can answer that, I'd appreciate it.
I mean, obviously, if the board gives us the direction to move forward on it, we would do everything we can to fast track the project. But to be honest with you, I don't see this project being up and ready to use much before November, December of this year. And that would be doing everything in our power to move forward and to build as quickly as possible. Typically, this would be a year job.
So hearing from your guys, so they're going to have to adapt, and they're going to have to do jury trials in other courtrooms, because it's just, you just can't build this overnight. I mean, they're going to have to do something in the interim to do that at that point. Right? I mean, and then we have the ROE is going to be displaced. How long is it going to take to build out those offices on the annex on the 3rd floor, which is a shell and was a storage room for state's attorney for evidence. So I don't know how much is still up there. I haven't been there in a few years, but how long will it take to build out for ROE if that's where they want to go, and probation and the other departments?
When I was giving you the 6-month timetable, that would be all in with all of the projects associated with this. So there would be multiple projects going simultaneously on this.
Okay, thank you, Nick.
Member Healy.
Just a little refresher on the history and the ROE thing. We were given about 6 months notice by the regional superintendent that she was being tossed out of her last place, and staff went to work, and we came up with this idea, and we were able to get it passed, and we more or less fronted the money for the improvements, and the regional office has paid us back
over the term of the lease. It has always been our, hope that someday we'd be able to find a permanent home for the regional office, whether it be on this campus or in another building or something, maybe combined with some other services. But, I don't think it was ever really thought that this would be a permanent solution to the ROE. It was just something that we had to do, and we had to do it really quick. Nick, if you remember, I don't know if it was 6 or 8 months total time from the time that the superintendent brought it to us to the time we had to have her open for business. And there wasn't a lot of time to do an awful lot more than to find vacant space on the complex and to build it out, in addition getting permission from the county board. So I just want everybody to remember that that's how this came forward.
Thank you. And all right, so remember, I'm going to let a couple other people speak. Obviously, we're going to need to continue this conversation, and we could spend all morning into the afternoon going through this one issue. I think we're going to need to continue this and maybe put it as a topic of conversation next week on finance, but I'll let people continue to comment for the time being. Member Selman, then Member Covert.
Thank you, Chairman, and I'll be very brief. I think one thing for us to keep in mind with this ROB solution is that the likelihood we leave phase 4 by the end of the year is incredibly low, because phase 5 requires adequate testing, adequate tracing, adequate treatment, and likely a vaccine. And getting a vaccine by January would be a historical medical breakthrough, earth-shattering fast track to get a vaccine that quickly. So I think it might be helpful to look at what are the things the ROE will have to get done, the trainings they'll have to get done within the next year, and whether how much of that can be planned now to be remote, so that we can be, because maybe we can reduce the need for this emergency space and continue working on a long-term space solution and do the trainings we need to do now remotely.
Thank you. Member Covert.
I was thinking about this. I don't know if it's possible logistically just to kind of present a solution, a possible solution for the ROE. Do you think it would be possible there's a lot of empty space in corporate buildings all along Deal Road and near Route 59 in Naperville. And I was thinking maybe if we could utilize the empty space that we already have and maybe transfer that lease money to fund, to apply it to the empty corporate space that we have, possibly. It's just an idea. So I don't know if that will logistically work for the ROE department.
Can I respond to that? One of the problems that we have, and Jim knows this, Nick, Tim as well too, looking at that, the dollar amount for retail or corporate rent or lease was something like $35 to $65 at a minimum a square foot. And I'm not a taxing body. I don't, I rub 2 pennies together to make 3 to try to make things work. So that was totally out of our realm of trying to do something. Plus there would be a cost again of a build out, so there was just so much involved with that. And so, I again, very appreciative of Jim and Nick, supporting us in this as well. And again, I'm not here to complicate things. I want to know what I can do to help. I want, as you are trying to meet your statutory responsibilities, I'm just trying to do the same thing as well.
We do have quite a few other things to cover on the agenda, but I see Member Healy wanted to comment, and then Member Pachalski.
Sadia, what you were talking about, we've been actually looking at this opportunity for about, Nick, 6, 7 years, and we continue to look at it, and staff continues to look at options that are out there. We knew that the location for the ROE was not a permanent one where we put it. It was just the only place we had available. You realize that we had a 6 or 7 month, I don't remember what it was, time frame to get her into a new place before she was going to be, actually, she was already out of, or almost out of her old place, and we had to have it ready by the time that she had to start doing these classes. So I'm sure that, by the way, I didn't know an awful lot about this, so Nick and I will be talking, I'm sure, over the next couple of days, bringing up some of the ideas that we've had in the past, and we'll continue to look at all options.
Sorry about that. I got booted out again, but I'm back in. I saw that Member Healy, I do want to move this conversation forward. We have still more to cover, but Member Healy wanted to comment on Member Pachowski. So go ahead, Member Healy.
That's okay. I already finished comment, and while you were off the thing, we were making fun of you, so don't worry about it.
I'm sure it was all well-deserved. Member Pachowski.
Can't we use various schools who might have the availability for this training? We could go to different schools and just have an intergovernmental agreement. I assume there might be schools that have space available, and it might be easier to access the school districts as far as use and availability for training. It might be a economical situation as well. So I thought maybe school districts might have space that we could use for REO training.
Unfortunately, that was never an option, that there was no space available.
In any school district in DuPage County?
Any.
Darlene
was trying like crazy.
I find that difficult because I think there's a bunch of schools that are alternative schools and things like that, that I just think we maybe do a little bit more due diligence.
Okay. Obviously, there's more to discuss on this topic, and I'm sure Nick and the state's attorney and the chief judge and Dr. Rossetti can all get together and start talking about some more comprehensive potential solutions to this and bring it back to us next week for further discussion. So with that, let's move on to the next topic we have for discussion, which is Finance Department.
Could I have one clarification? So on the 18th Judicial Circuit Court, is the board the 2.75 as far as planning and proceeding with it, bringing those items to board in the future? Is the board comfortable with that component? And then it's just the first component that we will explore more and figure out a solution. Is that correct?
Unless anybody has any strong objections, that's the longer term issues of addressing the need for these technology issues going into the future. I think that makes sense to plan for that because that's going to be there no matter what. Does anybody have any strong objection to the second part of that, recognizing they will bring individual procurements to us going forward? All right, seeing and hearing none, I think you got the guidance on that, Nick. So let's move on to the finance issue.
Okay. So this one is fairly straightforward. All this is kind of a reserve fund, more or less, for the expenses that we have incurred, we are incurring, and we will be incurring at the county. Obviously, guidance is changing daily, weekly, about what can be reimbursed. We know that the health department, in what their recommendation, they are covered by the allocation, but as far as the care center, the county jail and facilities management, probably three of the bigger expenses for COVID expenses, we want to have the money available in the future to reimburse. We know that, so we're recommending $1 million being set aside for reimbursements for the care center, and then $10 million overall for all the departments to get reimbursement. Once again, all of these must be reviewed and approved by finance and our auditor. And hopefully at the end of the day, we won't spend anywhere near this if the COVID pandemic, doesn't progress, but we want to be prepared. We want to be able to reimburse. And we know we have expenses out there that we have not captured yet, especially in the care center and especially in the jail. So we are requesting consideration of a funding level of $11 million for this.
And again, these are placeholders to allow us, as we're considering the grand scheme of $160 million, where we need to set some things aside to address future expenses. With that in mind, anybody have any questions with respect to that concept? Member Renahan.
Thank you, Chairman. Hey, Nick, originally I had heard 20 million kicked around as the reserve number. Are you comfortable now with the 11?
If you look, so the 11 million, we've really tried to dive a deeper dive in our estimate here. If you look at the very bottom, there's other reserves in there for other purposes. So this is kind of earmarked toward our expenses. And then you have other reserve funds down the line that we can talk about.
Okay, gotcha. Two different parts. Thank you.
Okay, any further questions or comments specific to this kind of reserving of money? All right, seeing none, hearing none, keep going, Nick.
Okay, So that's kind of the inside facing the DuPage County departments and elected officials. We're going to turn outside down now a little bit about maybe some assistance for other areas. We're going to talk about nonprofits, the local governmental, the small business, and then PPE, which could be either way, and then other county initiatives. So with that,
Some of this includes and encompasses some of the things that you suggested, you being the board and the committee.
absolutely, absolutely, yes. So, and at the very end, just so everybody knows, I have listed all of the initiatives that board members, the suggestions and everything that have come in. A lot of those suggestions are throughout what we're presenting for you as a board to consider and give us direction. But there is additional funding at the end that can be utilized for some of those other initiatives that aren't included in it. So next slide. At this point, I would turn it over to Mary Keating to talk about more community response, nonprofit assistance, with it all being run through community services. And I will turn it over to Mary.
Good morning. Thanks, Nick. So I just wanted to start by running through just a quick slide. This is additional funding outside of the Coronavirus Relief Fund that is coming to the Department of Community Services. So when Congress passed the CARES Act, they allocated funds to already existing programs. And so our department is getting an additional allocation for 5 of the programs that we already administer. 2 important things to note. Each of these funds has very specific parameters over how it can be used. So they're typically extremely restrictive in what we can do with them. But the good news, on the good news side, is the fact that the majority of them will be available through September of 2022. So we have some time to make some decisions about how we want to use these funds. And we can use them well beyond the expiration of the CRF funds. Next slide, please. So you'll probably recall that the first immediate human services need that we saw at the beginning of the COVID-19 crisis was the need for emergency hotel stays. The 3 shelter providers in the county, being DuPage PADS, Catholic Charities, and Metropolitan Family Services, all closed their shelters in March in order to reduce the possibility of transmission of COVID-19. The clients who were staying in those shelters were all moved into hotels, which was obviously a significant and unbudgeted drain on the finances of those nonprofit providers. So the board approved the provision of funding to pay for those hotel stays. So we're paying for those hotel stays with a combination of coronavirus relief funds. The ones you see there were listed on the spreadsheet. We also have some additional funding from the Emergency Solutions Grant that is set aside for future needs. Next slide, please. So in order to better gauge the needs of other nonprofit organizations during COVID, we reached out to our partners at the DuPage Foundation. So the DuPage Foundation had recently created an application for funding for nonprofit partners to address needs of the nonprofit community, and these are funds that the DuPage Foundation had raised from other sources. So it's important to note the foundation received 108 applications. So there were 108 agencies that requested funding. It was a total of $2.3 million in requests. Something that's really important to note is that the amount of the requests, typically what an agency will do is they'll submit applications based on the typical amount that's granted by a funder. So that 2.3 million is not necessarily, or it's certainly not an all-encompassing calculation of the full need, but what it does is gives us an illustration of the categories and relative scale of the needs that were expressed by nonprofit organizations. So you'll see in these categories, the number 1 request was for emergency financial assistance. Now that's not financial assistance for the agency, that's financial assistance that the agency would use to pass on to individual households for things like rent, mortgage assistance, utilities, those kinds of things. You'll see a number of other categories there. The second biggest one is recouping revenue loss, which we know is not eligible under the CRF program, but certainly many of these other categories would be eligible under the Coronavirus Relief Fund. Next slide, please. So given what we know so far about what needs have been expressed from the nonprofit community, we're proposing the following assistance programs for the nonprofits in DuPage County. The first would be a $3 million set aside for rent and mortgage assistance for residents who have lost income due to COVID. This program would be administered by agencies that already participate in our homeless continuum of care and have existing homeless prevention and rapid rehousing programs. That would be a total of about 10 or 12 separate agencies that residents then could reach out to for rent and mortgage assistance. The second category would be direct cost reimbursement. This would be specifically for costs that agencies have incurred for two primary purposes. First would be any of their IT expenses related to supporting telehealth, remote learning, or remote working. And the other category would be expenses that they have incurred relative to purchasing PPE or cleaning supplies, sanitation services, or other social distancing measures that they've had to implement. The idea here would be that those funds would be available to the just over 70 agencies that have received grants from the county over the past 5 years. The reason I'm proposing that is there are certainly hundreds of nonprofit organizations in DuPage County. These 70, 75 that we've partnered with over the last 5 years are all agencies that have been financially vetted by the county in the past. So we know the work that they do. We know that they are financially sound, and we've had positive relationships with them in the past. Next slide, please. So the next category would be a $1 million set aside for food pantry assistance. This would be accomplished through two venues. The first is that we would provide $625,000 to the Northern Illinois Food Bank to provide additional food to all DuPage pantries. So the Northern Illinois Food Bank partners with over 50 food pantries and feeding sites throughout the county and provides food in bulk to those partners. By providing a direct grant to the food bank, what we're doing is in a much more cost-effective way, we're supporting all of the food pantries in the county. The second venue would then be $375,000 to Loaves and Fishes, People's Resource Center, and West Suburban Community Pantry, so that they can purchase diapers, formula, cleaning supplies, and other non-food items that they can't get through the food bank. Those three food pantries are the largest in the county. They also don't have any particular sort of residency restriction. They'll serve anyone across the county. So that's why those three are identified as the recipients of that fund. And then the final category would be $1 million for residential and behavioral health service providers, with $500,000 set aside for residential service providers for additional staffing costs related to COVID. So this would be residential service providers like Ray Graham, Serenity House, Senior Home Sharing, other organizations that are actually providing housing for individuals, typically individuals with disabilities or seniors. The other $500,000 would be for behavioral health providers for additional crisis and counseling services related to COVID. So one of the things that we hear a lot about is the need for additional mental health services during the pandemic. So this $500,000 would help those agencies support the additional costs so that they can hire additional counselors and provide additional services. Next slide, please. So all told, the proposed nonprofit assistance program totals $7 million. If the board moves forward with this proposal, I'll certainly be bringing back specific parameters for approval. The other thing is that I think, given a lot of the unknowns about what exactly the actual costs would be under these various programs, I think we would certainly be looking at shifting funds between these different categories as we get into the fall or as we get into our initial allocations and see kind of where the needs are lying and whether or not we need to shift funds between categories. With that, I'd be happy to answer any questions.
Okay, a whole bunch of people have questions. I'll start with Member Covert, the Member Hart, and then we'll continue from there.
Thank you, Mary, for that wonderful presentation. I had a question about Northern Illinois Food Bank. I was just wondering, I know it operates a lot in Cook County, but I was wondering if, I know Cook County would also be receiving a CARES fund, which they would have to allocate as well. Do we know how much they will be contributing? And maybe if we could work together and see if we could drive down that number, possibly?
Sure. So I don't believe Cook County is one of the service areas of the food bank. The food bank does cover 13 counties, though. So the way I arrived at that number was that I reached out to the food bank and asked them if they had done any projections based on the increased need that they're seeing across all food pantries. They came up with a $3 million figure, somewhere in that range, and 20% of the, even though they serve 13 counties, 20% of the food provided by Northern Illinois Food Bank goes to feeding partners in DuPage County. So I simply took 20% of their total anticipated increased need.
Okay, thanks.
Member Hart.
Thank you very much, Mr. Chairman, and thank you, Mary, for the presentation. I had a quick question related to the behavioral health allocation that you walked through for $1 million. Would that also be open to individuals seeking substance use disorder treatment or consultation? I know mental health and substance use are often linked, and I haven't seen any allocations for substance use disorder since we know that has been particularly.
Yeah, I didn't call that out specifically, but I would certainly think that we could combine those two. The important thing for both the residential services providers and the behavioral health is that it has to be tied to increased service delivery. So I don't see any reason why we couldn't include that in that category, because they are very often linked.
Right. Thanks.
Okay, Member Elliott, then Member Dessart, then Member Tornatore.
I kept asking.
So, Mary, thank you for your presentation on this. This is one area
I saw it this morning
where I just had some questions about whether, and I understand we're limited by the nature of the CARES Act that it has to be COVID related, but this is one area of the spending that I wish we could devote.
I can't hear myself. I'm not sure.
And I'm just wondering if whoever's talking could mute themselves.
Hey, Judge, I think that's you in the background. If you could mute your mic, Judge Karen.
In particular, I think I had a little bit the same question that maybe Member Hart had. I know we're always trying to find ways to get more money to the HOPE task force. I have read media accounts of increased opioid issues associated with the pandemic. I've read an awful lot about increased need for mental health services in the pandemic. I'm wondering if we can find a way to get more in here. And I guess, Mary, my question to you is this $7 million request, is this a bottom up or a top down request? In other words, were you assessing all the different places where we could find spending and then you arrived at 7 million? Or did you start with 7 million and then figure out how to divide that up beneath that?
I guess maybe a combination of the two, but then the other limiting factor is the capacity of the nonprofit community to spend this kind of money in what is now a 6-month time frame. So remember that first slide, we do have additional funding coming in. Not all of it could be used for substance abuse counseling, but we certainly could have some funding available for that purpose for 2021, as long as it's related to COVID through our Community Services Grant Fund or Community Development Grant Fund. The 7 million, frankly, was sort of in line with the initial small business loan program or small business grant program through Choose DuPage. So, and then I kind of filled in the numbers from there. So while it is sort of started from 7 million and figured out what made the most sense for categories, I do think if I were to reverse it and build it from the ground up, it might be similar. I think that the big question is rental assistance. You know, I think there would be enormous need for rental assistance. However, just the ability to stand up a program and spend it in 6 months, I think is going to be a real challenge.
Okay, I understand. I'll just say for myself, I don't view the small business program and this as being sort of logically related to each other. I am very concerned about the need to deliver services to our residents of the type that you're addressing here. And I would hope that if you saw an ability to deliver those services, and if that went above 7 million, I want you to know that I, for one, would be absolutely willing to entertain that, because I do think these are critical services that we've got to deliver.
Well, my thought on process was that we would have some sort of an application process particularly for those two categories. I mean, the ones that are these kind of reimbursement, the reimbursement of direct costs, I envision as kind of, you know, show us the receipts for what you have spent since March 1st. For these others, I envision an application process. So I'm certainly open to having an open application process with the understanding for the nonprofit organizations that this has to be new and expanded expenses, and it has to be spent within the next 6 months. And actually, by the time we get grant agreements in order, we're probably talking about maybe 5 months. And so if we went through an application process and you know, the need was, let's say instead of 500,000, it was, you know, 1.2 million, I would certainly be coming back to the board to see if there was if there were other ways that we could identify setting aside more funding. So I'm certainly open to that, and I think the process will kind of give us the most specific idea of the need.
Thank you, Mary. Thanks for everything you guys are doing.
I'm going to try this in order. Member Dessart, then Tornatore, then DeCiani, then Selman, then Rutledge, then Chaplin.
I agree with.
Go ahead, Member Sir. I'm sorry.
I agree with Member Elliott. I think of all the buckets we've investigated today, this is the most important bucket. And I think 7 million might be, is definitely too low. Mary, I was wondering, one of the things I put on my wish list for this fund was a prescription medication program for those who've suddenly become unemployed and suddenly have lost their insurance and can't afford their maintenance prescriptions. Diabetes, MS, high blood pressure, high cholesterol, that sort of thing. Do we have an avenue where we can help those people out?
I would think that individuals who are uninsured are probably eligible for Access DuPage. So Access DuPage should be eligible. Let me think about that. But certainly additional coverage for Access DuPage would be something that I would be interested in making sure that we write the specific parameters so that they would be eligible there.
Excellent. Thank you.
Mm-hmm.
Thank you. Member Tornatore.
Thank you, Mr. Chairman. Thank you, Mary. Mary, you and most of you know, I also serve on the Illinois Housing Development Authority Board, and IDA received $396 million under the CARE Act. And it's for, among other things, emergency mortgage assistance and emergency rental assistance. Have you had any now that's statewide, have you had any contact with anybody at IDA for some of that emergency rental assistance money that could come our way?
I certainly haven't seen anything. Typically IDA would work through nonprofit agencies. They wouldn't be working through us, or they would have their own process, but I haven't seen anything coming out of IDA about specific programs, but I can certainly investigate that.
Okay, I'll find out too. Okay, thanks. Thank you.
Member DeCiani.
Thank you. Very nice job. I appreciate your advocacy for our most vulnerable. You mentioned all food pantries. Would those include townships or strictly the nonprofits?
If the townships are receiving funds or are receiving food through the Northern Illinois Food Bank, they would be included in that. They would be eligible. So just for some background, the way this works is the county provides, and the county has provided funding to the Northern Illinois Food Bank for several years now in about $150,000 allocation in our budget. But the way that works is the food bank purchases additional food, and then all of their food pantry partners go onto the food bank's online system to basically kind of purchase food through their online system. If they're one of the DuPage partners, they have an additional list of commodities that they can order that food pantries that are outside of DuPage don't have access to. So if the township food pantries are purchasing food through the Northern Illinois Food Bank, they would be receiving, they would be the beneficiaries of some of this additional funding.
And the township
lastly,
category that's further down the agenda that we have, so everybody's aware.
Right.
Yep, I saw that too. That's what I was just asking. Lastly, on the a lot of our agencies, naturally, like Ray Graham and Trinity, and a lot of the agencies that actually provide residential services for our most vulnerable, also have healthcare staff workers that are there too. You know, they've incurred big overtime costs, et cetera, with the COVID challenges. I would hope that you know, those would be eligible expenses, knowing seeing the additional information that was given to us on May 28th about verifying, et cetera, would be eligible for those, you know, reimbursements. Would that be correct?
Oh, yeah, that's absolutely correct. Those kinds of agencies I would see being eligible basically for a couple of different of these categories. So their direct costs for PPE or sanitation, those kinds of things would be, they'd be eligible for reimbursement. They'd also be, a number of them I saw from the DuPage Foundation applications were instituting telehealth or other ways for their residents to be able to communicate with others during the periods of isolation. And then the $500,000 that is set aside for residential service providers is specifically to handle those additional staffing costs over time, you know, additional health workers coming in. So yeah, that's specifically what that's for.
Thank you.
Okay, thank you. Member, someone waved me off, so we'll move on to Member Rutledge and then Member Chaplin.
I thought Sam was ahead of me, but that's okay. Thank you, Mary, and thank you, Chairman, for putting all of this together. Mary, I know we've talked about this a couple of times about the income compared to poverty level and being able to qualify these people for assistance. What I'm concerned about are the ban on eviction soon going to be lifted. And are they going to adjust that income versus poverty level? Because some people may have been making well over the poverty level just months ago, but now they're to the point where they're hitting those marks, but it's too recent for them to acquire any assistance. Can you talk about that a little bit?
Right. Well, if the $3 million that we're talking about in the CRF funds, that would be entirely up to us to determine how we wanted to set those parameters. The federal funds that are coming, they do have, well, some do have income restrictions. One of them in particular has shortened that rear view mirror look. You know, we used to have to look at the last 90 days. Now we only look at the last 30 days. That's for one particular source. So it's not as, it really kind of depends a lot on how far back you have to look. So, you know, at this point in the the COVID crisis. Individuals who lost income probably lost that income in March or April. So they're already 2 or 3 months in. So they would most likely, if they're eligible, they'd most likely be eligible because we're in that longer, we've got a longer time frame to look back through. So but for the coronavirus relief fund, this 3 million, that would be entirely up to us. I would say that we would most likely be looking at one of the requirements being that individuals would have to have a 5-day notice prior to eviction, so that we would know that they were that far in the process, that their landlord had notified them of the possibility of eviction. You know, we know there's over 20,000 people filed for unemployment between March and April. So, but many of those people maybe now are reemployed, or, you know, had the means to continue to pay their rent or pay their mortgage for a month or two. In order to kind of narrow make sure the assistance is going to those greatest in need, we do need to develop some sort of parameters over who's eligible so that we don't completely overrun and overwhelm the system.
Thanks, Mary.
Member Chaplin? No, nothing?
I'll answer. Thank you.
All right. Any further discussions from Mary? Member Pachalski?
On this rental program, Addison has a lot of apartments, and I've received calls from landlords regarding these stay on evictions. Is this program month to month, Mary? And does the payment go directly to the landlord or the bank, or does it go to the tenant to pay the landlord or bank?
You know, all of the rental assistance and homeless prevention and mortgage assistance programs in existence now and in the future will always pay the landlord or the mortgage company.
All right, thank you.
Okay, any further, Member Renahan?
Hey, Mr. Chairman, I'll be brief. Hey, Mary, awesome job. I'm excited about this. I said 10 million. I'd like to, if we could get a bump on food pantry and the behavioral and substance abuse health, I'm all in. Thanks.
Thank you. Great discussion by everybody. We are moving into a totally non-controversial subject, that being the $43 million requested by the municipalities. This may be time for another break. At some point, we're going to have to consider a lunch break or consider the possibility of looking at the last Tuesday in June. Member Zay is already waving that off as a notion. So do we want to take another 5 minutes now and then get into the municipal discussion? Let's do that.
Thank you, Mr. Chairman.
I'm hoping not to talk. That's why I have David Fieldman on. I want him to answer the questions, not me.
Whoever's ready to proceed, if you can unmute or put your cameras on so I know I at least have a quorum of people available. It appears we do have a quorum, so I believe we are ready to continue. Nick, are you there?
So our next item that we're going to discuss is local government support. And I have a feeling that we have about 52 or 53 YouTube viewers out there on our meeting right now. And my guess is it might be mainly for this one. So I will turn it over to Cheryl, who has kind of become our expert on this one. So Cheryl.
Sure. Good morning or good afternoon. Can everyone hear me? Can everyone hear me?
Yes, we can.
Okay, good. Thank you. Yes. Thanks so much. As you know, there's over 350 units of local government in DuPage County. This initial list is just for the board's consideration based on input that I've received. We selected these 3 units because they have had a direct, response assistance, providing a lot of assistance to our residents over the past 3 months. It certainly doesn't exclude the board from contemplating other units of government. We're just wanted to have kind of a starting point discussion this morning. So on this slide, we have the 3 that we'd appreciate some board direction on today. Municipalities. I think all of you have been on some district meetings with your mayors and village managers. Originally, Chairman Cronin had reached out, I believe, on May 14th to set up a commodities program for reimbursement of, PPE, technology, infection control, et cetera. Since that time, there's been additional discussions with the village managers and the mayors, and they would appreciate a larger discussion, which I'll get to on the next slide, in terms of a per capita reimbursement that would be subject to eligible expenses. The next unit of government would be fire protection districts. Fire protection districts provide fire service to both unincorporated and incorporated. I think over 425,000 residents of DuPage receive fire service from a district. So certainly they have had increased commodity costs and also first responder costs regarding COVID. And last are the townships. Most of them do have food pantries. A lot of them have bought extra food costs themselves. As Mary Keating pointed out, they also receive assistance from Northern Illinois Food Bank. But I know Addison Township in particular had contacted us. Their food costs have more than doubled, tripled, and they've also had to buy additional food storage equipment. I think even a forklift for to store some of their food items. Townships also provide emergency assistance to their residents, which could be $50 for a tank of gas or maybe $100 to help with a utility bill. So that's part of their reimbursement as well, in addition to commodity costs. Next slide, please. So first up, our municipalities. There's 34 in DuPage County. On slide 34, which is a couple ahead, we broke out, GIS broke up, thank you, Tom. The population, 831,013 incorporated residents, and we broke out if the 5184 per capita was applied, what that amount would be. That would be basically a cap that each community could submit eligible expenses between now and the end of the year. There would need to be a process set up with finance and the auditor. And as we've discussed briefly before, our federal lobbyists, and I believe the auditor and finance, recommend hiring a third party as another layer of protection and to lessen the risk for the county. As several people have already mentioned, the original CARES Act that was signed into law on March 27th was very specific in terms of the guidance. And I would just say on page 603 of the CARES Act, it says there's 3 rules for coronavirus fund expenditures. Necessary expenditures due to the public health emergency, COVID, and payments that were not accounted for in the budget most recently adopted. The problem is the guidance, which is not statutory, but the guidance that has been issued by the Treasury Department on April 22nd, May 4th, and May 28th, it continues to evolve and change. And as Nick pointed out, there's some gray areas with regard to labor costs and salaries in particular. I think there's no doubt, and Bill Viney agrees, that a percentage of police and fire payroll can be submitted, whether that's 100% or 30% or 40%. That's something that I, can't speak to myself. I would be more comfortable with a third party helping us, but certainly I think that's something that can be worked out with the municipalities in terms of that specific amount. But that is what they are looking for, the per capita. State's Attorney's Office has already drafted a very lengthy IGA that would be a requirement, and also a certification form that would be signed by the village manager or the mayor. And there's some smaller issues that would have to be worked out in terms of, Naperville and Hannibal Park are in multiple counties. There might need to be a percentage applied if they submitted, all their PPE expenses for that community. So we do have David Fieldman, who's the village manager of Downers Grove, on the line as a participant. Thank you, David. And I know he can answer probably more specific questions you may have, but I'm going to stop there because I think we are looking for some guidance how the board would like us to move forward with a municipal program. Thank you.
Okay, I'm going to open up the board for questions and comments. Start with Member DeCiani, Member Krajewski. You're on mute and seem to be frozen, Member DeCiani.
We're good. You there? How's that, better?
Yes.
Yeah? Okay, very good. We had a district meeting via Zoom last week, and memo that was issued I believe end of May, which clarified that public safety are responsible. That was a question. Initially, it was cited by our law that something was already like public safety, not necessarily reimbursable, and you would have anything above budget would potentially reimbursable, except dedicated. But the clarification issued at the end of the day states public health salaries, budgeted or eligible for reimbursement. So I think this opens the door instantly for to be able to put their per capita, and I think there's are interested in this located to that front with the end of the day immediate cost and also fuels, and they need to spend these by the end of the year as well. But they want to go through a cumbersome process of is this isn't they with safety ability.
Member DeCiani, I'm going to try to summarize some of your comments only because you're buffering badly and it's difficult for a lot of people to hear and understand what you're saying. I think what you've indicated is you had a meeting with your mayors and managers in your district. They have expressed that they want this per capita. They want the money up front. They don't want to have to go through what you described as a cumbersome process of submitting the expenses. They do believe, and then you've spoken to lobbyists and they've spoken to lobbyists, and they do believe that they can buy the expenditures that they've submitted as a per capita for the salaries of their first responders. Does that pretty much encapsulate what you were saying?
That's, and I did speak to the Congress, the Krishnamurti, and they all heard that clarification, crystal, that safety budgets are in this and converse. So it's a question of above what budgeted, wasn't budgeted, public safety expenses are fully, whether it was budget or not. So I think, and that the mayor's in a position we down expenses let us the fires if the county has issues, but with safety ability being a clear, nice, eligible expense, it puts the county of give them their dollar, them do their job rather than admit nonprofit and other these are expenses related to, that's my concern, and I with doing that.
Again, a lot of that was buffered, so I'll try to just clarify. You've said that you also spoke to a congressman. They feel very clear, the mayors and managers that you've spoken to feel very clear that they are entitled to this money and that it's clearly reimbursable despite what the questions raised by Cheryl and the statutory interpretation. So I think that's
again, follow-up. The follow-up that was in the May is still clear and confirmed again with the Ombudsman's office as well.
Okay. All right, Member Kajewski followed by Member Zay.
Hang on 1 second, Chairman. I got a train going by my office there. Thank you. I'm fine with the allocation numbers. The only thing I have a question for or issue to look at is just using my District 3 as an example. I have the village of Downers Grove, village of say Hinsdale, Westmont, and Naperville, who have their own fire departments, and then the rest of the communities, so say like Darien, Willowbrook, Woodridge, Burr Ridge have fire protection districts. So the municipalities that have their own fire departments, of course, are going to incur some additional expenses with their fire department. So if we're allocating $3 million, if that's the number, it says 2 to 3 for fire protection districts, I would say we just allocate that $3 million on a per capita basis and then give it out to the fire protection districts or an additional amount to the municipalities if they have their own fire department. Just because I think that'd be unfair for municipalities that have their own fire department who have incurred those expenses. Thank you.
Okay, Member Zay, Member Ozog, and then Member Desart. Member Chapman.
Thank you, Mr. Chairman. I know we've had a lot of discussion on this, and I don't think there's any easy answer, but I think the municipalities are asking for this per capita. I think that's the best option. We will have an IGA that they have to sign to go into that with us. But my only problem is that, we're just not going to hand them a check for that. They're going to have to draw off of this. They're going to have to show us their expenses. I'm just not going to hand them $1 million. And then if they only use 500,000, how are we going back to get that? So it's the same process we're doing. We're drawing off it. We're asking all our elected officials to give us your expenses, what you're doing. I think that's the only fair way. I know they don't want to do that, but I think that's the only way to protect the county is give them the per capita number, and then they have to send in their expenses and draw off of that number. And from what they're telling us, they're not going to have a problem doing that. But I think that's the only way. I don't think we can hand them a check and just say, well, we hope you have the expenses. I think we have to have some verification from them, have a third party person in, protect the interest of the county, because ultimately, as we've all heard, we're responsible for that money. And if we get audited, and we don't want to fall into that problem where, we didn't know about, a bunch of expenses that's going to, cost us and then have an issue with our municipalities.
If I could interrupt, I apologize if I'm out of order. This is Dave Fieldman speaking on behalf of the conference. We agree with County Board Member Zay's approach. We'd be happy to submit proof of paid. There's the train that went by Brian's office. Sorry. We would be very happy to submit proof of paid invoices for eligible expenses and work on a reimbursement basis. Thank you.
Great, thank you.
Okay, thank you for that. I think Member Ozog, you were next, then Member Desart, then Member Chaplin will go around the horn. Everyone get a chance.
Thank you, Mr. Chairman. I was very happy to meet last week with the representatives, with our mayors and managers from Glendale Heights, Glen Ellen, and Wheaton. And I agree with with this type of allocation. But today I'd like to bring up, I heard in the past 24 hours from one of our Glen Ellen Park District board members and the executive of our park district. And I'd like to propose that perhaps $1 million of this 43 million is allocated toward park districts. There's 33 park districts in DuPage County. That would work out to
33 divided by $1 million is about $30,000 each, or you could do it on a per capita, which works out to about $1 per citizen. I believe almost every park district borders are different than municipalities, so I believe almost everyone in DuPage County is covered by a park district, but they are going to be facing at least PPE and physical changes to their facilities. It's all fluid right now as to how much outdoor exercising is now available, where you could have an outdoor class, you can do outdoor yoga classes and spin classes. At any rate, I think it would be a good idea for them to be included as well. They're an important amenity to our county, and I'd like to have a discussion about perhaps taking a small portion of this money and allocating it for park districts. Thank you, Mr. Chairman.
Okay, thank you. And just to address that briefly, there were several questions and several members raised questions about park districts. I don't know if it's something that would want to be taken out of the municipality distribution if we choose to do a municipality distribution, because there is an uneven distribution of park districts and their populations. There had been a discussion of the possibility with staff of reimbursing them for submitted commodities expenses, PPE, cleaning supplies, and so forth, as opposed to just a per capita distribution of additional money, recognizing all of the different things we've been talking about today that people are concerned about saving money for. I don't know if the board has a sense of they're comfortable with a commodities distribution for park districts on submitted expenses. Who would favor that just as a general concept, as opposed to a per capita distribution? And who would favor more of a per capita distribution? So we've got, looks like there's more support, commodities-based distribution for park districts, but we can look at that. It's a matter that we can continue to discuss as we around the horn. Well, go ahead if you have an additional comment.
Mr. Chairman, I wanted to bring it up today, though, to be sure. I do think that we should include park districts. Again, I was not offered any particular idea of how much their expenditures were, but I'm throwing out $30,000 in terms of PPE, buying plexiglass dividers, maybe a tent for outside facility, that sort of expense. So commodity would probably work. I just don't know what bucket or tent we would put that under, but I would definitely like us to consider that. And I thought this would be the place to bring it up. So thank you.
Okay, thank you. Member Desart, then Member Covert, then Member Chaplin, and we'll keep going around.
I agree with the per capita expenditure to the municipalities. In fact, the $51.84 on my wish list, I had it at $55 per capita. I think that they're under asking here, but anyway, I do agree with the per capita. And I do agree with Mr. Zay that they should submit their expenses. And I wanted to bring up the other governmental unit as well. Cheryl Marquet had said that she's only considered these 3 governmental units, but I do agree that park districts should also get an allotment of this money. I do not think it should come out of the municipal funds though, but I do think we should consider park districts as well to give them some money for their COVID needs. Thank you.
Thank you, Member Desart. Member Covert?
I agree with Member Desart. We actually had a quite productive meeting last week with Member Healy, Member Desart, and me, with the Mayor of Naperville, Mayor Cherico, and the Mayor of Aurora, Mayor Urban, and Mayor Brummel of Warrenville. And the Park District had also emailed me last night, and I too feel that they should be reimbursed separately and not included with the municipal, because they are partially supported by property taxes, and approximately 50% of Naperville Park District's revenue is generated from program fees, facility user fees, sales, and other non-tax revenue. But this specific revenue is used to support the cost of maintaining parks and facilities and recreational amenities that the community relies on. With commodity expenses, Naperville Park District has about $34,000 for they're asking $34,000 in reimbursement for costs of commodities, but they lost $1.1 million just in 1 month time span, and that's a lot of money. So I kind of guess we need something that's a combination. I can't say totally per capita or totally not per capita, but they would need more money. And I think it should be separated from the municipal costs and just, in support of the city of Naperville makes up a good chunk of DuPage County. We are roughly about 20% of DuPage County. So we're a large part. And I know the capita expense, I would want more for the city of Naperville and city of Aurora. But that's not, we have the $51.84 per capita right now. I would want more for my city, especially after the aftermath of, COVID and rallies and everything that's going on. We appreciate the 4,954,000. We appreciate that, but I would want more for the city of Naperville because that doesn't even make a dent in our costs. But that's all I have to say. Thank you.
Okay, thank you. And I'm going to continue to keep going around the horn here. I think at the end, I'll try to throw out some suggestions as to where the sense of the board is and get a feel from everybody. It's difficult to do that on the fly. So I'll go to Member Chaplin, then Member Rutledge, then Member Tornatore, Renahan, Elliott, and we'll keep going.
Yes, thank you, Chairman. So I just wanted to mention that if we hire this third party, I think it would be a really great benefit to the county and for the municipalities. I think this third party could help navigate us through the language and the guidelines of the CARES Act. And I think we can use the CARES money to pay for this third party, but I think it would be very beneficial. We had a nice meeting with our District 2 reps on last week, and Pete and I both supported this funding. I think it's fair, and I think it's important. They did take a big hit with loss of sales tax revenue from restaurants and their businesses. So I really do feel that this is a fair amount and it's the right thing to do.
Thank you. Member Rutledge.
Thank you, Chairman. I do support the per capita number, but I'd also like to see some additional funds earmarked for communities that are particularly hard hit by COVID, like West Chicago and Addison. I am concerned that there are communities that are not going to be able to absorb the additional cost beyond the per capita. I like Member Zay's idea about making them account for the money we're giving them rather than just giving them a bulk of money. I also liked Member Chaplin or whoever's idea it was about a third-party administrator for this. But I do want to advocate for those hardest hit communities that are really going to struggle coming out of this. So that's my 2 cents. Thank you.
Thank you, Member Rutledge. Member Tornatore.
Thank you, Mr. Chairman. First, regarding the park districts, I too was contacted by a couple of park districts, and they have been hit hard, and they do have additional expenses. A lot of their expenses that are going to be coming up will be as a result of the summer programs for children. They're going to have to purchase tents and additional PPE and sanitizing equipment, et cetera. They have, as everybody else has, taken a hit regarding their before and after school programs that were not utilized because parents of these children were at home during the 3-month period of time. But let's all remember that this money is not to compensate people for, or municipalities or any other entity for lost revenue. The Roselle Park District alone lost $500,000 for 3 months that they had to refund for before and after school programs. So I can only imagine what Naperville's was. We cannot use this money. I've got the legislation in front of me. It's very clear. It's not supposed to be for a loss of revenue. If we start to do that with park districts or anybody else, then the county has a huge loss of revenue, which would probably exceed the $161 million we have. So we've got.
I don't know. We lost 161 million.
Well, whatever. But my point is that we would exceed that money if we started looking at loss of revenue across the county. I have never had a problem with giving the municipalities any of the money that they're entitled to if they submit expenses for that money. If the municipalities are content with a $51.84 cap per person after they've submitted those expenses, then this is not any different than what was submitted to them seemingly months ago when we started out with the suggestion that they get compensated for the commodities first and then other things later on. I'm totally against any per capita distribution simply based on population without the supporting documents that substantiate their expenses. I'm against it, number one, because for my purposes, it flies in the face of the legislation, which says it must be COVID related. And number two, population alone is not an indicator of how much a municipality may have spent on a COVID related expense. I think I mentioned it last week. You can have a smaller town that spent more per capita than a larger town on COVID related expenses because they've got a hospital in town or a nursing home in town or a senior citizen home in town, or have more minorities in town. There's a variety of reasons why the per capita dollars don't make any sense to me unless you wanted to use it as a cap. As far as I'm concerned, I don't think the municipality should have a cap at all. If you can justify $60 per person in expenses and it comes out to that and we have the money, then they're entitled to it. So this whole thing about the $51.84 to me is a red herring, because the letter that I saw from DuPage Mayors and Managers said, and maybe I'm wrong, but they said essentially, give us the money based on $51.84. And then as we spend it, we'll give you the receipts. That's not what I'm in favor of. I'm in favor of give us the receipts. And when you do, you'll get a check as long as it's COVID related and that passes muster with our third party administrator. If that's what we're all agreeing to today, then I don't think that changes anything that we've had and as our idea from day one. If we're going to simply write a check for almost $5 million to Naperville and then say, Naperville, as you spend this, please let us know why you're spending it. And by the way, if it doesn't pass muster with the feds, then you have to pay us back. That's a recipe for disaster, because we will then be chasing Naperville for money that we shouldn't have to do. And the bottom line is we're responsible for this money. We are the trustees, if you will, of this money. So I'm a little confused as to what I can see your hand on. I'm a little confused as to exactly how we're allocating this $51.84. Bottom line for me is whatever the expenses are that a municipality or a township or a park district or anybody has, if we've got the money, we should share that money. But to simply do it on the basis of population and wait and see what those bills are, to me, just doesn't make a great deal of sense.
Can I respond to Member Tornatori, Chairman?
Well, there are people that are still waiting. I'll come back to you. Member Renahan hasn't had a chance to speak, nor has Member Elliott, and I'll give you the opportunity. But
it's response to Member Tornatori.
I understand that, but everybody wants to respond to different thought processes. He didn't call you out by name. He's just talking about the different ideas. So I'll give you your opportunity. Member Renahan, and then keep going.
All right. Thank you, Mr. Chairman. I don't find this particularly controversial. I think we all probably agree that our municipalities need the money. I'm more in favor of, as Member Tornatori said, show us the receipts and you get the money. And I just don't think it's really a very controversial thing at all. There's relative fairness there. As far as the fire districts, I do agree with Member Krajewski in terms of, let's share the wealth. Let's just make it part of that capita amount. And then as regards to the park district, I think we need to for me, that's almost a wait and see. Like if this HEROES Act comes to fruition, then we are talking about receiving lost revenue at all levels of government. So yeah, that's where I stand.
Okay, thank you. Member Elliott, then Member Dessart again, then Member Hart.
Sure. So I I agree. I gather with almost everyone that's spoken. I don't have a problem with the 43 million. I don't have a problem with it being allocated per capita. I do want to see the money distributed as expenses are documented. That makes sense to me. I guess the one thing I'm concerned about is, and I'd like to get some clarity on this. There's legal gray area here. You have a statute that says one thing. You have administrative guidance that says something else. It's not quite clear whether either of those are going to change. You've got different interpretations. So my concern is that if we have a third-party administrator, is that one of the duties of that person going to be to play judge and say, hey, Warrenville, I know that you're relying on the administrative guidance and that you think your police payroll is covered, but the county's position is we're going to be incredibly conservative because we want to rely on the statute. So we're just not going to pick that up. Thanks. Have a nice day. That's kind of what I'm concerned about. During our meetings with the mayors, they indicated that part of the IGA is this indemnity agreement, which I gather is in there, but I'd kind of like to hear a little bit more about what this process of review is going to be by this third-party administrator.
Well, and let me just jump in on that because this is what I envision, and Nick or somebody or Cheryl can comment on it, but what I would envision is a third-party administrator being an auditor type of person to review whether or not what's being submitted is being submitted as they are indicating. We're not really going to be able to put them in a position to make judgment calls as to whether what they're submitting is truly in compliance. There will have to be some discussion of an agreement about the language, but ultimately there is going to be an intergovernmental agreement whether we give them money up front or require requests for reimbursement. They're going to have to sign an IGA saying they take responsibility if they have submitted expenses and put together the documentation in support of those expenses, and it turns out it's not in compliance with the CARES Act, and they will have to reimburse us for that. So there will be multiple levels of it, but I agree. I don't know how a third-party evaluator can really make legal judgment calls on that. They're more auditing in addition with their own auditor, although it would be overwhelming for our auditor to do all of it, reviewing the paperwork submissions for the reimbursements.
Okay, thank you, Mr. Chairman. And if that is the concept of what we have in mind for the third party, I'm quite comfortable with that. I would also
Cheryl or Nick, do you have any thoughts to the contrary on that? I know that's we've looked into that issue already somewhat.
This is Cheryl. I think there are very few gray areas. I think for the most part, like the village manager said on the district calls, they can read the Treasury guidelines. I think for the most part, they will submit totally eligible expenses. The few sheets that I've seen, a couple of villages were asking for replacement of water late fee revenues, which I don't think are allowed. I don't think the auditor or a third party will need to spend a ton of time scrubbing these spreadsheets. I think for the most part, they'll be fine. Regarding the labor costs, Bill Viney expected there would be some more guidance just because there is a little bit of a conflict between the statute. And if you read the May 28th guidelines, it really looks like you could submit, 100% of your payroll, but then other rules say it has to be COVID related. So, if 100% of your police department is doing COVID, then they're doing, COVID. And I think that's the only gray area, but I think that's certainly something that can be, agreed to with the village managers and finance and the auditor. The auditor might want to speak to this as well. I don't see that as a big issue for the most part. I think it's pretty clear cut what the guidelines are. There are just a few little areas.
Thank you, Mr. Chairman. And I would just say on the park districts, I got the same communication, a number of others. I do favor getting some money to them. I do favor it as a reimbursement of commodities. And I would not take it out of the municipal, the $43 million. I would find a separate pool for that.
Okay, thank you. Member Dessart?
Yeah, thank you, Chairman. I just wanted to address Member Tornatori's concerns and say that don't worry about that at all. When we had our Zoom meeting with the mayor of Aurora, the mayor of Naperville, and the mayor of Warrenville last Friday, They totally understand that it's going to be expense reimbursement. So any concerns you had otherwise are not there. They totally understand that that's the way that we're going to run this program.
Okay, thank you, Member Hart.
Thank you, Mr. Chairman. I think my position's been stated by the other members effectively. I just want to thank the District 3 mayors and managers who joined the call with Member Krajewski, Member Renhan, and myself last week. I thought the conversation was very productive, and I want to thank them for their engagement. I think along with most on the line, I'm supportive of the per capita arrangement as a cap to draw off of using the expense forms provided. And I also agree with giving money to park districts, but outside of the 43 million. Thank you.
Okay, thank you. I think everyone has pretty much had enough. Oh, Member Eckhoff, go ahead.
Sorry, I'll be brief. I was informed by Marianne from Glendale Heights that 2 municipalities do not have park districts, namely Glendale Heights and Villa Park. So factor that in however you want to. And maybe I missed this when you were talking about the third-party administrator, but if, let's say, somebody submits, he or she denies it, and the municipality objects, is that the buck stops with us to make a decision on that, or how we're going to deal with that?
I think that would essentially be the case. They could appeal it in some fashion to us, but there has to be some final authority. And since we have the legal obligation to report back to the CARES Act, if we've retained a third party to determine that and determine it's not eligible for expenditure, come back to us and we can vote individually as a board. But
yeah, I think the buck stops with us. But hopefully they're going to be able to expedite it, use a consistent standard for everything. But I don't like giving over our authority to a third party, non-elected person.
Okay, Auditor Grogan texted me. He has some thoughts on this. Auditor Grogan, please feel free to comment.
Can you hear me?
Yes.
Okay. Just real brief. The payroll issue is probably the biggest bugaboo that we have. My office and myself, we look at federal grants all the time. And what is concerning to me about municipalities submitting, for instance, their police payroll and then just saying, please reimburse us for a third of it, is no federal grant that I have ever seen doesn't ask for either timesheets telling me when you worked on the grant or a time study saying this is how we extrapolate to how much time we're spending on the grant. There is a presumption in the guidance, but that presumption also is talking about people who are substantially dedicated to the grant. For instance, the sheriff, as soon as the COVID crisis hit, he dedicated a person as the COVID officer, which to me, that's like a 99% sure that that's going to get covered because that person there is substantially dedicated to that. So if you just say assign a likelihood that the sort of just back of the envelope, it's going to be 33% of, police payroll is going to be covered. Maybe that's an 80% victory for us, but then you're going to end up potentially leaving a bunch of money on the table that you may have had hard costs that are going to get crowded out by that. If you look at the FAQs, the mayors gave you, one of the FAQs, but the next one actually gives an example about, substantially different use, which is one of the criteria that somebody going basically outside their job description. And 2 of the 3 examples were police officers doing things, enforcing compliance and stuff like that, which kind of makes you lend a doubt to it. All police officers are going to be fine, or else they wouldn't have put that as an example in the other FAQ. So it is tough. There's going to be more guidance. My prediction is that guidance will say you have to do some sort of time study. You have to do something where it says, this is what I actually did. The health department, as much as they're working on it, they gave us timesheets that said, this is what the person did. They have an assistant dental hygienist. What did they do on COVID? Oh, they helped do contact tracing. So they're tying it somehow as opposed to just the formulaic 1/3 of police payroll is probably going to be a place to limit your risk. That's just my opinion.
Right, and we're clearly going to have to work out at least some of that because I suspect payroll is going to be a large portion of what these submitted reimbursements will be. I am going to want to frame the issues and go forward, but I do see Member Tornatore has another comment. I want to try to move to the phase of getting the sense of the board on this, but go ahead, Member Tornatore.
Thank you, Mr. Chairman, and I appreciate Member Desart's speaking to me regarding regarding my concerns. And if that in fact is the case, then I don't have any concerns. However, I did read yesterday's memo from DuPage mayors and managers. And that memo states that they are looking, their request is for funding on a per capita basis, underlined, to be used for all eligible reimbursable expenses, underlined. They want to use the same approach as the state. Another bullet point specifically says the county would distribute $43 million to municipalities in phase one. This next bullet point is the U.S. Treasury guidelines allow the money to be used to reimburse many categories. The municipalities would use the funds only for reimbursement of eligible expenses. Municipalities will submit proof of payment of eligible expenses and will take full responsibility with complying with the act. This is a simple approach which will potentially reduce work by county staff. It will allow the municipalities to best utilize CARE Act funding and use the money for qualifying eligible expenses which best fit each individual town. Perhaps I'm misreading it, but that seems to me that they would like $43 million dispersed on a per capita basis. And then as they spend the money, they will submit an expense sheet to us or a receipt saying this is why we spent it. Or this
And I understand that was the original.
And that can't be what.
Tori, let me just comment because so we can move this forward. I understand that was their original request. That was the request they came up with all along. We already had a comment from a representative of the mayors and managers indicate that they would be willing to work on a reimbursement basis. And it seems to me that the overwhelming sense of this committee and the board is that that's the only way this is going to go forward. So I understand.
Chairman Larson, I'm all with you, except this was dated yesterday. It came on a DuPage Mayors and Managers website, and I'm hearing from one village manager from one town today. I don't know if he speaks for all 34. All I'm doing is responding to what I got yesterday from DuPage Mayors and Managers. And if that's the case, and I just want to be clear with them because they're on the call too. I have no objection to submitting expenses and paying them what they're entitled to. And if that exceeds $51.84 per person and we have the money, they're entitled to it. But I'm not in a position to agree to just write a check based on per capita and then say, as you spend the money, send us the corresponding bill. And I don't know if that's their intent. It certainly seems that way in the memo that I received yesterday.
If I could jump in, Mr. Chairman, sorry, I'm out of order again. Dave Fieldman speaking on behalf of the DuPage Mayors and Managers Conference. I have confirmed that I am speaking on behalf of the entire conference and for the board on this. And I apologize if we weren't clear in our memo dated yesterday. It is entirely appropriate to be a reimbursement approach. We're very happy to submit proof of payment and work on a reimbursement basis. Thank you.
I appreciate that clarification, and Member Tori, I appreciate your bringing that to our attention. I want to make sure that is clear. It is the sense of the board, I think, to do it on a reimbursement only basis. Member Desart, I saw your hand up. Was it for anything other than clarifying that point? You're on mute.
Yeah, thank you, Chairman. On the memo, it does look like it's saying that they want a check cut for them. You're absolutely right, Member Tornatori. But based on the verbal meeting that I had with my mayors on Friday, they understand that they need to submit expenses for reimbursement.
Okay, thank you. All right, I think it's been a great discussion on this issue. I want to try to get the sense of the board. If I'm reading everybody correctly and reading the room correctly, so to speak, we will, of course, have to work out the IGAs and so forth, but is it the sense of this committee that we support, and raise your hand if you support, a per capita availability of reimbursement on that per capita distribution as submitted by the mayors and managers, but only for reimbursed expenses based upon an agreement of what those expenses will be with a hired third-party administrator to review the submitted expenses? Who's in support of that proposal? Looks like every member of the board is. So there's the guidance. We will be able to do that. Now, with respect to park districts, is the board in support? Raise your hand if you're in support of the notion of reimbursing commodities expenses submitted and not taking that money out of the allocation of a cap, for lack of a better term, to the municipalities, as opposed to some different proposal. Who's in support of that? Looks like the majority of the board is in support of doing that, at least for commodities. Now we have two other categories. We have townships, and you heard earlier about the issue of the food banks. Most of the expenditures, I would think, for townships would be in the range of or related to their food bank expenditures. But just because we're giving money to the Northern Illinois Food Bank doesn't mean that they don't have to purchase that from the food bank. So what was contemplated here is not, again, writing a check or doing it by population, but allocating with the townships submitting expenses in the same way that the municipalities would, as just a number to throw out there, $2 million, approximately $225,000 per township, with the sense that frankly, most of them won't come anywhere close to that, but that as a placeholder to reimburse townships for their clear COVID-related expenses as submitted. Raise your hand if you think that's a concept that you support. Seems like everybody on the board supports that. So that's the guidance with respect to townships. And then the last issue is fire districts. So this is a little bit of a complicated issue. There are fire districts that cross boundaries and so forth. I would submit that a way to, we've talked about allocating based upon submitted expenditures for fire protection districts, and allocating a certain amount of money, not doing it by population because that's virtually impossible to do. The complication, the question would be, how do you offset costs for those towns that pay for their own fire departments versus those who rely upon fire protection districts, and a way to do that. So I'm going to open this last one up for a little bit of discussion to get the board sense, because I'm not clear myself as to where we want to go with this. Member Tornatore.
Thank you, Mr. Chairman. I think that would be problematic if we were writing a check for $51.84 per person to the municipalities. But if the municipalities are submitting bills and we are reimbursing them, then it really isn't relevant if they have their own fire department or they're served by a fire district, because that will be a submitted expense as well. It'll just be who we cut the check to. We'll either cut it to the village of Roselle that has their own fire department, or the Bloomingdale Fire District, which has their own fire district. It shouldn't be a problem as long as we're only writing checks when we get expenses and bills.
That's a great
point. It's only a problem if we're just writing a check on a per capita basis, as I see it.
That's a great point, and I think that's fair. Obviously, the only time it would really come up is if somebody came up against the quote unquote cap and started to complain that they want more money. At least moving forward for the time being, and we can always address down the line if we have additional money that we can distribute depending upon what is spent, we can deal with that. But other than that, would we be comfortable setting aside, at least as a placeholder, the money that the staff has recommended to set aside for fire protection districts for reimbursement of their expenses? Raise your hand if you support that notion. Seems like everybody is in support of that. So that's the guidance on that issue. I think that covers everything on the local.
Chairman Larson, could I ask a quick question? This is Cheryl.
No, you can't. Yes, please go ahead.
Thank you. I appreciate the guidance. With regard to the fire protection districts, and I think David is still on for the village managers, but because, as Member Tornatore pointed out, there's 15 municipal fire departments. If they are compensated, then we're looking at the fire districts. So DuPage mayors and managers was going to work with the fire districts on coming up, and this was Member Healy's idea. I don't know if he's on now, but maybe saying whether it's $5 a person or $10 a person, whatever the municipalities are spending on fire, you should allocate to the fire districts, because a town like Bloomingdale, they're getting the same amount of money as another town with a fire department, even though they don't have one. And then their fire district is also benefiting from money coming to that community. So it's kind of hard to sort out, because if you're submitting fire payroll, then you really just can't do commodities for fire districts. So it is very complicated. So I guess I would ask on my slide that I had for fire protection districts, the village managers were willing to sit down and work out some type of formula for the fire protection districts, and then the 100,000 unincorporated residents that are served, that would be what the 2 or 3 million that would be put aside for the county would assume, and then the municipalities would assume a similar cost for the 19 municipalities that get their fire service from fire protection districts, if that makes sense.
No, this is Dave again. We're fully supportive. Happy to help, and we're greatly appreciative of your direction here today. Thank you.
Okay, I see you.
Can't the fire protection districts just submit their expenses through the municipalities residents who they served? So if Bloomingdale Fire Protection District.
Some of them cover multiple municipalities or unincorporated areas.
Well, I don't know about the unincorporated, but at least with the municipalities, if they spend it on Roselle residents, they submit it through Roselle, that becomes part of their request. And until you get up to the top. I mean, that seems.
Again, keep in mind, we're trying to provide higher level guidance that we hope and expect that the mayors and managers, as was just indicated, will work with the fire protection district community to work out these expenditures. And hopefully they're not going to come anywhere close to the $44 million we're going to spend. I did get a text from Nick Kottmeyer asking for a sense of where we would want the funding for the fire protection districts to be. I don't remember if there was a specific number proposed in this. I believe.
I think I put 2 to 3 million as a placeholder. Yeah.
Chairman Larson, I was wondering about the park districts. What kind of funding level for the park districts?
For the park districts, are we comfortable with it just as a placeholder of $1 million for reimbursement of expenses for the park districts, recognizing we may not get there? Raise your hand if you support that number. So at least the majority of the committee support that.
I apologize. Chairman Larson, can you clarify that again?
Say again, Member DeCiani, you're really hard to understand.
Don't talk to Pete.
You want clarity. The issue is we're trying to put a sense of a placeholder. We've all agreed that we're willing to consider reimbursement of commodities expenses for the park districts for submitted reimbursable expenses, similar to what we're getting from others, but we're looking for a kind of a cap number placeholder to put it here. And I suggested $1 million. That seems to be what the committee is comfortable with, unless anybody has
with that
objection.
Thank you.
Okay. And now with respect to the fire protection districts, Member Desart, did you have a comment?
I did. I would appreciate if the placeholder was closer to 1.5 million, because that would give the districts access to $50,000 each. Thank you.
Oh, okay. We got Member Zay, the Member Covert.
Yeah, I mean, just because we had a few park districts, send us letters, I'm sure if people knew we were trying to get money on this thing, we could probably get about 33 school districts who have been impacted even more by this, who have continued to have to give breakfast and lunch to students, have to re-go through their schools, have to figure out how to open in the fall with PPE, with other things, that I think their costs are greatly much more than park districts at that point. So again, I was not in favor of the park districts getting any funding off of this, but where do you draw the line? That's the problem, because I'm sure school districts are much more highly impacted by COVID than, you talk about technology and e-learning, just what they've probably spent in the last, 4 or 5 months, and what they're going to have to do in the fall is going to be much greater than what any park district is going through at this time.
Okay, Member Covert, then Member Ozog, then Member Chaplin, then Member Renahan.
Thank you, Mr. Chairman. With respect to the fire districts and fire departments, I would feel more comfortable because of the complexity and the delicate nature of it, I would like to understand it a little bit better before making a decision today. So maybe if we can get more information and table that for a bit.
Well, again, we're just talking about broad placeholders in the grand scope of this. And certainly that's why I'm going to ask that the mayors and managers in the fire protection districts come back to us with some additional information on their discussions of how they would divide those up. But it's a valid point. Obviously, these are complex issues, and we're trying to figure out how we set placeholders so this money doesn't go away and have no ability to control it going forward. Is that fair? Member Ozog, then Member Chaplin.
Regarding the park districts, I can say, I can assure you the state did not make any allocation for park districts, but I would believe that the schools are probably going to be having definitely other funding sources available to compensate for what they've endured this past few months and going forward. So I just think that as a line item on our property tax bill and an entity that entities that provide a public service, I think that we should consider this. And again, we can look at funding formulas. I understand not everyone in DuPage is covered by a park district, but a lot of times the park district borders are larger than the municipalities that they may share the same name with. So I personally think $1 million is a reasonable amount, and it would at least cover commodity issues for the park districts. We can figure out the funding situation later. Thank you.
Thank you. Member Chaplin, I did see that you're there, although I was advised that Chief Roberts from the Fire Protection District organization is available to speak. Do you want to make your comment first and then let him go?
Let the chief go.
Okay, Chief, please, if you have some comments, go ahead.
Thank you, Chairman Larson. This is Chief Rogers, Warrenville Fire District. I'm the president of the DuPage County Fire Chiefs. So thank you for your time. I'm here with Chief Creston from Woodridge, as well as our Assistant Chief, Chief Dinah. I really appreciate your discussion. I think it's important to look at the essential employees. I think you have a tough job to do, but we'll continue to work with the mayors and managers. The fire districts were our own entity, so I'm sure it's a tug of war with the municipalities, but we stay, as fire districts, we stay in our lane. We document our expenses between supplies, our manpower, and we can tell which calls are COVID related. So whatever data or information you ask from us, we could easily provide that. And, you know, 2-3 million is healthy. Whatever the amount the county board feels they want to give to the fire districts, we'll work with that. But if you look at the payroll, we're going to exceed that. So let's all of us try to work together with whatever the guidelines you provide us and the amount of money. We're happy and thankful for that. We'll work with you on that.
Thank you, Chief. I appreciate it. Member Chaplin.
Yes. Excuse me. Thank you, Chairman. So with regards to the park districts, I understand that there's a concern about the park districts being funded, but Cheryl mentioned that there's 350 local governments in DuPage County alone. So we have sanitary districts, library districts, we have a lot of other taxing bodies. So what I might suggest is, I don't know if we have if we have leftover money, maybe then let the park districts submit. But I think there's a lot of, then libraries might ask, might want a piece of the pie, and sanitary districts. I mean, we have the DuPage Water Commission, though they're not on our taxing body, but there's a lot of other government entities out there. And I understand where the park districts, coming from. But like I said, maybe we could, if there was funding left over, but I think we have a huge group. We have a lot of buckets of where we're putting our money, and, park districts compared to maybe some of the nonprofits that are doing work, or the food pantries or things like that. I'm on the fence on that a little bit. I wouldn't mind, if we had, like I said, extra money, or if we go through this and we do have $1 million extra, then I would most likely support it. But I don't really want to take away from something else right now at this point for that. That's just my thoughts, but thank you.
Okay, Member DeCiani, and Member Rene, and Member Tornatori.
I think letting mayors and managers work with our staff on towns that have fire departments versus towns that don't have fire departments, that per capita that we're giving those municipalities we should not have to have the fire districts on a separate budget, because the allocation per capita, if it's Elmhurst, it's got its own fire department, they get their allocation per capita and it's done. If it's Woodridge, for instance, that has a fire district, then the overall per capita between the fire district and the village should be that total amount per unit. So let staff work it out with mayors and managers. I don't even know if we necessarily need a separate fire district budget. If we work it out that way, only really just to cover the unincorporated areas is what we would need at that point. But it should be fair, it should be equitable, and towns that have their own fire departments, it's clear cut. Towns that don't, they've got to work out a ratio, and the overall is not to exceed the per capita. I think it's pretty simple.
Member Renahan, then Member Torrentori.
Thank you, thank you, Chairman. As Member Eckhoff had pointed off, not all communities have park districts. So we kind of go back to the issue of the fire districts. Should that be included with municipalities or not? I think also Member Chaplin brings up a good point. I mean, if we're going to go down every single line item, I mean, I'm sure the libraries would like money. I mean, I'm sure there's lots of other entities we could help out too. And I just think first responders, fire district, yes, absolutely. Park districts, for me, we're kind of getting down the line, and we have, $161 million is a lot of money, but yet it's not. We see how fast it can go. So that's where I stand.
Member Torrentori and Member Elliott.
Thank you, Mr. Chairman. Regarding the park districts, it was impressed upon me that the park districts are essentially dealing with babysitting services, for lack of a better word, during the course of the summer. They're taking care of these children of people who are going back to work, who have been taking care of these kids on their own. We have allocations in our budget that Mary Keating gave us for seniors, for a variety of things. I think that the children who are participating in park district programs should also get compensated as well. Those park districts should be compensated as well. I don't mean to circle back, but I have to, because I want it to be clear to Member DeCiani that there is no per capita allocation to the municipalities. So as far as fire districts are concerned, many of which serve municipalities, not simply unincorporated areas, but incorporated areas as well. Bloomingdale being an example. The Bloomingdale Fire Protection District serves the people of Bloomingdale, an incorporated area. If we gave separate allocations to the fire districts based on commodities or expenses, and expense reimbursement based on expenses submitted to us by the municipalities, everyone will get the money that they've spent, regardless of whether their firefighter was in a fire district or was in a municipality. So there's really no need to make this any more complicated than it is. If we decide that we're going to start writing checks per capita, that's when we have to then back out money from those municipalities that have their own fire departments. But as long as we're asking for commodity expenses and reimbursing based on those expenses, it doesn't matter where the firefighter wears his or her hat. It's just a reimbursement of expenses. I hope I'm clear on that. Thank you.
So just for the sake of clarity, because we've already had this discussion and not to revisit everything into Wednesday, Thursday, and Friday, what we voted on and what we were unanimous on was allocating in our overall budget for the expenditure of CARES Act money, a per capita distribution as requested by the mayors and managers, but not as money paid up front, as sort of a cap for expenses town by town based upon what they've requested. Obviously, there will be flexibility down the line depending upon what money we have available and whether or not we can add additional money to that. There is the added complication that for some town, we're certainly not encouraging these towns to come up with creative ways to spend every single dollar imaginable. I would hope they're not going to do that. But there may be some towns who will, because of the issues they have to deal with, spend very close to their cap of what we've established per capita, which is in the list that you have on one of these other slides. If that happens and a town comes to us and says, well, we spent much of that on our fire department because we have a fire department and the town next door uses the fire protection district and you gave them separate money, that's kind of where the issue comes in. But what we've heard is from both the mayors and managers and the chief of the fire protection districts is they will work out some sort of agreement in that regard. So here's my suggestion, that we, at least for purposes of this budgeting, allocate $45 million, $43 million being the money we've already talked about for the municipalities, $2 million additional for fire protection districts as a more or less a cap, a placeholder in this budget, and then allow them to work out those issues amongst themselves. Is that something, raise your hand if you support that as a concept to cover both fire protection districts and municipalities? Anybody? All right, so we don't, people waving.
Well, what's with the extra 2 million, Member Larson?
That's for fire protection districts. They're
going to be allocated out of the municipal side. So there should be.
Well, first of all, as you know, Member,
let's just cover the unincorporated.
There's over 100,000 people in the unincorporated areas of DuPage County. So that's part of the problem. 10% of our population or more is in unincorporated areas. And there is an issue there. I'm just trying to set aside or get some sense of how much money we can
I'll support it.
To address it. All right, we have Member Elliott, then Member Desart. We're going to keep going around it. Member Eckhoff.
I just wanted to address something that Member Chaplin said. And she raised a good point. We do have, we're talking about the park districts, the fire protection or fire departments in the municipalities. And I favor making provision for them at this time. But we also have a lot of other units of government that may, in some cases, are very likely to have commodities purchases that are caused by COVID. What we're doing today is really projecting, right? We've got a lot of big numbers in here. We're not spending today, but we're anticipating what we might spend, what we might not spend. If I'm reading this correctly, we've got, I think, $20 million in contingencies, and we've got another 10 million lined up as future small business loan programs. There's a substantial amount of money that may be left open at the end. I am not adverse. In fact, I think it would be a good idea to reach out to the units of local government and to say to them, listen, you tally up your commodities purchases, send them into us. If when we get down to the end and we've got money left over, we don't mind distributing to local units of government who've got commodities purchases that aren't picked up by these by these initial allocations. I don't have a problem doing that because if, for example, the Wheaton Sanitation District or the DuPage Water Commission or whomever has had to incur COVID expenses, and I'd much rather pay those down and get the money into their hands than have to remit any portion of this back at the end of December.
Okay, thank you. Member Desart, the Member Eckhoff, the Member Zay.
Thank you. And that's a big picture of what Member Elliott said. I do not want to give a dime back. I want to spend every dime of this money that we've been gifted. I didn't raise my hand when you talked about the municipalities and the fire protection districts because I would like to just vote on the whole thing just to give staff direction. I know we're not, but just to give staff direction. The municipality is getting 43.1 million. The fire protection district getting 2 million. The townships, you didn't add that in, that's 2 million. And the park districts at 1 million. And I'm pushing for the park districts because you know what? If we can talk about giving the health department $2.5 million just for communications, when most of the communications that they would produce would be aired or printed for free as PSAs. So I don't know why there's a $2.5 million communications bill with the health department. If we could talk about that, we could at least talk about giving the park districts 1 million. Thank you.
Thank you, Member Eckhoff.
I didn't have a whole lot. I'm just going to say, I think Mr. Tornatore and I are saying the same thing. And if we're not, I'm sure he'll agree with me once I talk to him.
Okay, thank you, Member Zay.
Thank you. And I agree with Member Desart. If we're going to give the park districts $1 million, in my area, I've got Bartlett, Carroll Stream, Bloomingdale, Winfield, West Chicago, and Warrenville that are all fire protection districts. So why, if we're going to give $1 million a park district, why am I only giving $2 million to my fire protection districts in that area? That number needs to be extremely much higher at that point. I mean, if we're talking, we had said 2 to 3 and we went down to 2. I mean, I'd rather go to 3 or 4 million for those fire protection districts. If we're giving park districts $1 million, I would think our fire protection districts that, represent a good majority of our county, about half of the county should be getting more. So.
Okay, we've sort of gone round and round and round and round in this. We already, I think, approved the 43 million as a placeholder allocation for the municipalities with the terms that we've already discussed. I threw out $2 million as just a number to add in there for fire protection districts while they work out some discussions with the municipalities. If we want to vote a different number, do we want to say $3 million? What's the sense of the board on whether or not we allocate, again, just for purposes of placeholding to have this discussion now, $3 million for fire protection districts? Who supports that number? Let's see, 1, 2, 3, 4, 5, 6. All right, looks like actually a majority of the committee does support that. So for now, we will do that. All right, now we have, again, we're just providing guidance to staff. That's not meaning that money's going to be spent. Now, we talked about $1 million. There was a sense of the committee of $1 million for park districts, but then there was a lot of additional discussion. Remember, it started throwing out a different number of $1.5 million. So I'm going to come back to the $1 million number. Do we want, for purposes of allocating right now, just so that we know, and asking them to come and submit expenditures, do we want to allocate that amount of money now, or do we want to hold off on that one? If I throw out the number of $1 million as an allocation, who supports that? See, 1, 2, 3, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So it looks like we have majority of the committee is supporting that now. We will work out the details as we go forward. We're kind of limiting it to commodities. Again, I am hoping, and you all have the ability to reach out to your municipalities and your constituents and your fire protection districts and encourage them. Recognize, while we do want to not have to return the money to the federal government, just as we don't want to return it to the state because we don't get our fair share back, these are all taxpayer dollars. These are all money that some taxpayers paid to some level of government. And I'm hoping and assuming everybody's going to take their responsibilities to spend that money responsibly and well and in compliance with the CARES Act very seriously, because that is the legal obligation and our moral and ethical obligation to our constituents. So I think that now covers the local government portion of things. There may be other issues that will come on down the line. And if we have more money left over down the line, certainly we can revisit and look at that. With that, then we are up to the small business relief program. We're going to submit on Tuesday of next week an additional portion of the allocation of that. We met as a committee yesterday for a little over an hour to go through some additional loan applications. But Greg can perhaps speak to where he sees that going. Greg Bedelow. Or whoever wants to present this portion.
Greg, are you still there, or would you, he's good, he's on there? Okay.
Nick, can you hear me?
Yes.
Thank you, Mr. Chairman. As you mentioned, and as Member Elliott mentioned, we are in the midst of the first round, I guess we'll call it, of the Small Business Relief Grant Program. We will be bringing forward an additional 238 applicants at some point on top of the 148 that we're bringing to the county board next Tuesday. That tranche represents an additional 1.5 million, and total applicants remaining still represent funds that could potentially exceed the $7 million that the county board originally allocated. Therefore, in light of the fact that we could exceed the amount, we did make the request of county staff to allocate some additional funds, either to make sure we take care of everybody who qualifies and is in the first round. And we have been talking to businesses, and there is a desire for additional funding for bigger businesses. We did reopen the portal for applicants yesterday, and we have another 120 applications that just came in the last 24 hours. So based on the fact that, word has kind of been spreading, if we could get the total requested funding level into that $10 million range, we think we could quickly and efficiently take care of all of the applicants. If we choose to come back for another program, obviously that would be at the discretion of the board.
And just to clarify, Greg, when you say total funding of $10 million, you're asking about another 10 million over and above the 7, or 3 million more?
3 million more. I'm sorry if that was unclear.
Okay. And so just to frame the issue, I see Member Elliott and Member Dessart and others are going to have questions, but to frame the issue, the portal was open and then closed and then open and closed because we were looking at applications that would meet the dollar amounts that have been appropriated. Whether we choose to ask for additional funding and put it out there and reopen the portal, and whether that would create additional requests is anybody's guess. We are also asking a lot of Choose DuPage in terms of the capacity for processing that. With that, I will open it up for discussion. Member Dessart, then Member Elliott.
Thank you. I think you clarified my question.
Member Rutledge.
Pardon me, can you hear me?
Yes, I'm sorry. I saw Member Rutledge. I was just acknowledging her as well.
Oh, I think you answered the question, but so it was open then closed. And then Greg, I got an email on Friday saying it was open again. So is it open now or is it closed? Are you still accepting?
It is open. It is open. We were going to send an email out to all the county board members today. We closed it because we received 1,198 applicants that totaled in excess of $10 million in grant relief requests. So we figured we have to close it because we don't want to be denying that many people. Once we scrubbed those initial 1,198 applicants and reviewed what was left over, if you will, now we're short of the 7 million that you originally allocated. So that is why we've reopened the portal to make sure that we put the full 7 million out into the business community.
Thanks, Greg. I was going to call you on Friday and ask you what this was about, that it was reopened, but time got away from me. So thank you for answering the question. Thanks.
You're welcome.
Thank you, Member Dessart. Member Elliott.
So I'm glad to hear, I'm a big supporter of this program, obviously, but I'm going to the last page of the presentation. And unless I'm misreading this, we actually have 17 million on this last page allocated for this, because we show the 7 million allocated to date. That's included in the 29 million in the upper left-hand corner. And then we show additional funding of 10 million.
Yeah, so I think there was a miscommunication on that.
Right. So I think that what that means is we've got, I think, $7 million sort of unaccounted for on this sheet now. Just wanted to point that out. I know that we've talked a little bit about a desire perhaps to have some additional funding for mental health, opioid, those sorts of things, or other services. I just wanted to point that out.
Member Elliott, if I could interject there, that would also be if the county board, in conjunction with advice from Choose DuPage, elected to do a second, if you will, grant program for businesses of different sizes that may not have been, where the first program might not have been available to them. But we're simply not in a position at this point to make that recommendation, that there's enough interest out there at this point for a full-blown second program. I apologize if that was confusing. That's my fault.
No, I totally get it. I guess I am assuming, and maybe I'm wrong, but I guess I'm assuming that if there is demand, that this board's going to be receptive to an additional 3 million. My question was just whether we're looking for a total of 10 or a total of 17. I think that's been clarified now.
Okay, Member Ozon.
Assuming it's another.
You know what? I skipped Member Rutledge. Her hand was up first. I apologize. I didn't mean to leave. Come back to you. I'm sorry. Trying to keep it.
Thank you, Chairman. Hello, Greg. I'm going to advocate again for at least, hindsight is so clear. And I've spoken to Western DuPage Chamber, and they're defunct at this point because they received $3,000 from the PPP loan, which disqualified them for these funds. And so if we're going to release additional funds for this, I think we have to take a look at that. They're the people on the ground that are helping a lot of small businesses. And that additional funds could have kept them up and running to be able to provide that support. So I'm just going to advocate that we take a look at that if we release additional funds for this program. Thank you all.
Okay, thank you. Member Ozak, sorry to cut you off. I didn't mean to cut off Member Rutledge.
Thank you, Mr. Chairman. I don't think an additional $3 million is enough. I would like to see us double the original amount for a total of 14 million. Not sure where we can pull this from, but I really think that this is an important program, and I've already at least known of one recipient who told me they were able to get this funding, but I think the need is out there, and I'd like to see it go to a total of 14 million. Thank you.
I will say that we've gotten feedback from the checks that have gone out. We've gotten a tremendous positive feedback from those. And I think the more money we put into the program, probably the more requests and need you'll get. They can keep the portal open longer, and you'll probably get more people asking. But I'm going to come to Member Pachowski. I think Nick had a clarification remark, and then Member Kudusky after that. So Nick, did you have to say
thank you to everybody who did this, because this is a small business person, a hairstylist, somebody who cuts hair, and these people really need it. And we got a lot of good people that needed this money. So I support this extension. And Greg, great job.
Thanks. Nick, did you have a comment before I go to Member Krajewski? You wanted to clarify something?
Yes, thanks, Chairman Larson. I just want everybody to be very clear. So for the spreadsheet and for the accounting, how I accounted for it. So the 7 million is already spent more or less, or accounted for at the very top. This 10 million is absolutely in addition to that 7 million. So theoretically, you by saying yes, this funding level is good, you are saying there's $17 million total for small business. So that 10 million shown there is over and above the original 7. So I just wanted to be clear, whether that's the level you want, that's how it's accounted for.
And basically, so the way Greg allocated this was anticipating, based upon what we've seen so far at the level, recognizing there was a cap of $1.5 million for the size of the business, that 10 million would more or less cover that. But if we wanted to go to businesses a little bit bigger than that, that he could ask for another 7 above that, which would go to the $10 million. Is that correct, Greg?
That is, you've said it perfectly, Chairman Larson, better than I could have.
Okay. So then Member Krajewski, then Member DeCiani.
Thank you, Mr. Chairman. So Greg, let me understand, you had over 10 million submitted and then you scrubbed the list and you got below 7. So you've reopened it, but
Correct.
with the 122 that have come in, have you exceeded the 7 now? Are you up to 10? Is that what I heard?
I do not, I don't know using the same formula that we used on the original 1198, if we have the same percentages of applicants who either are not in DuPage, we would probably not get to the 7 million from the original amount of money that the county allocated.
Okay, so even with the ones that currently submitted?
Correct. That's why the portal remains open until.
So you'll keep if we approve another, you're looking for another 3 for this program, you'll keep the portal open for, however long it takes to fill up another 3 million.
That's correct.
Okay, thank you.
And then we can have a placeholder potentially if we want to increase the size of businesses and do another $7 million. It's built into this budget.
That's correct.
Okay. Member DeCiani.
I think the program's working out great. Greg, you're doing a great job. I've heard from many businesses that have already received money and they say, now I can pay my rent. So, I mean, that's pretty telling. And I'm all for supporting the budget as it stands. Thank you.
Okay. I think we've more or less heard from everybody. Any other discussions? Are we comfortable with the plan as it currently exists, with an additional 3 million being allocated, with the potential for a second tranche around potentially modifying the program once we've determined the expenditure of the $10 million? Is that acceptable to everybody? Raise your hands if you're comfortable with that process. Seems like we all are. Okay. So that's where we are on that. And then as we continue to plow forward, we have one last category before we go to member initiatives, which is the PPE stockpile initiative. Nick, I'll let you take over from this.
All right, now can everybody hear me? Sorry about that. So it's
Yes.
pretty much me for the rest of the presentation now. This item right here, the PPE stockpile, we heard from many of the members interested in exploring the PPE stockpile for different uses out there. But in talking to the various elected officials, especially the sheriff, care center, and facilities management, there is a real need moving forward for procuring and obtaining this both for 2020, 2021. So what we're recommending for this item would be obviously what their exact needs are. And then it's once again, it's more of a space saver to supplement what they have and to reimburse them. And then obviously we heard a lot of members wanting a general stockpile, either for the governmental use, hospital, medical use, or even general population in maybe certain sectors of the population. The problem that we have here, and everybody's got to realize, I mean, we have 4.85 million for a PPE stockpile. OEM and our procurement department have been working tirelessly trying to find PPE. And the thought is that we don't think we can get 4.8 million. And in addition, if you factor in, I know OEM is trying to still continue to work with the state of Illinois as well as the feds to get stockpiles. I know that that's been difficult. we'll continue to do that. But even if we put 4.8 million in here, I don't know if we're going to be able to buy 4.8 because it's just not available. So we just kind of have a recommended funding level, target level of 4.8. We'll do what we can, but we might not be able to achieve it.
Okay, any feedback from the board on that? Member Chalsky, Member Zay, then Member Selman.
As long as we pay the vendor, we don't have to get the product by that time, can't we? It seems to me, I know what you're saying, we're not going to have the ability to get it, but it seems to me if we've paid them and prepaid it, wouldn't that allow us to receive these after December 31st?
You are absolutely right. Money out the door is the requirement of the fund, but and it will definitely help us in the long run. But if we want to do some kind of a PPE distribution for the citizens, we might not be able to get that PPE to distribute. But you're right, money out the door is what is required.
Okay, Member Zay, then Member Selman, then Member Chaplin.
Thank you, Mr. Chairman. You know, that's my issue. I know a lot of board members agree with me that we need to get PPE in. And, you know, we got some PPE kits at the Water Commission. It's basically hand sanitizer, gloves, and masks. I mean, they're about $30 a piece. I think the problem is, like Nick said, is trying to get it. I think we all want to get it and possibly, you know, make sure that, you know, the sheriff, the care center, our first responders, but we also need to look at some of our lower income people. So if we could just, you know, try to get it, and if we can get it dispensed out to people, that's the big thing. But that's my fear now. Not only us as a county, but every state, every large city, I'm sure every business is looking for PPE at this point. So if we can do it, great. I think we're all behind, you know, helping our citizens out and trying to do some kind of distribution to them. We can work with Mary Keating and her group, but that's what I'm concerned. That's why I was for months been saying, let's get PPE. And again, if we can get it on order, and even if we get it after the fact, I mean, like we said, we don't know how long this is going to go on. And I'd rather us stockpile it here and not depend on the state and other people and the federal government for this, that we have something in stock that we can help our people with.
Thank you, Member Selman.
Thank you, Chairman. I'm wondering if there's an opportunity to work with NACO or ISACO to sort of work as like a purchasing consortium, because I think that's really the problem we've seen, you know, at the state level, and we've heard that from our own governor, is that, you know, Illinois is competing with California, competing with New York to get a scarce amount of resources, and it's driving up the price. But I'm wondering if maybe NACO or something can help say, okay, we're going to buy for counties and try to be one buyer as a local level, rather than us, you know, competing against Cook and Will and Kane, like we're going to end up doing for even the amount of PPE we can find.
Great suggestion. I wish Member Healy was still on our chief of NACO stuff, but something I think that will be explored by the staff as we look for ways to obtain this. Member Chaplin.
Yes, thank you, Chairman. So I agree. I think PPE is one of the most important things that we can purchase for our staff in our county and our residents. So if we can, you know, pay for it right now and order it, pay for it, have it on, you know, standby, I think that would be, I think it's so worthwhile, because as we know, we're hearing more and more how masks protect, hand washing is, you know, safe, disinfecting our count, you know, having hand sanitizer in your car. So I think it's so worthwhile. I mean, this is, I think, is one of our most important initiatives, really, that we can do. It's something, well, if it was available, it would be easy to do. But I really think this is so worthwhile. So I hope we keep it on there, and I hope we order, and I hope that we are able to do a distribution, especially to our lower income areas.
Thank you. And I'm sure you saw some of the comments from Mary Keating that we would work with our not-for-profit community to assist in that distribution effort. Okay. With respect to this issue, is everybody, raise your hand if you're comfortable with the numbers that have been proposed, recognizing we have to figure out ways to accomplish that. Looks like everybody is in support of that. So, okay, we have a couple of other areas, but I'm going to try to do this a little differently. We've been here a long time. And it's been a great discussion, and I appreciate it. We have this additional DuPage initiatives programs, which is essentially, for the most part, a copy and paste of the emails and suggestions that all of you provided. I have, at least in watching and paying attention to what's been discussed, think that most of this has already been covered in the discussions we've had. I am going to open it up to the board that if you feel a suggestion that you have made has not been covered in the discussion thus far, raise your hand and let me know if you want to continue this discussion. Member DeCiani and then Member Zay.
I mentioned it earlier, but as far as a testing site on the east side of the county, that's something that I will be bringing through HHS along with some of our county board members who have brought this to my attention and mayors as well. But I put a number out there at 2.5 million and I see that site potentially being in Addison or somewhere on the east side of the county. I like Addison because of the incidence of COVID, and we really and those are our lower income folks in a lot of cases. So I just want to make sure that that's out there, and I'll be putting partners together, working with Karen Ayala as well to make this work. But I think we need something on the east side, and that's where I'm thinking Addison would be a great fit. Thank you.
Thank you, Member Zay, and then Member Chaplin.
I just don't want this to end, Bob. My legs are numb, so I don't think I can get up anyway.
Thank you for your contribution. Member Chaplin.
Thank you, Chairman. Just real quick about the testing facility on the east side. We had talked about that at our District 2 meeting. You know, another great solution to that would be the mobile sites. And we did talk about that a little bit. You know, it might be a little less expensive than putting a temporary site there. You know, we can bring mobile sites out. So that's also another possibility. And I think that is in our funding. So, and Karen did say that they have funds for extended testing. So I'm pretty comfortable with where we are on that.
Okay, thank you. Anybody else? Last thing before Member Zay goes into a coma.
Larson, just a reminder, you need to do a roll call to adjourn the meeting.
I understand there's actually the contingency fund. We'll cover that as well, but I see Member Dessart has a question or a comment.
Yeah, thank you. I really feel strongly about the prescription medication program to help those who have just lost their jobs and have no insurance. I really feel like that's an important program. So I will be talking to Mary Keating on ways to make that happen. I know she gave me one avenue, and I'd like to pursue that with Mary. Thank you.
Thank you. Any further discussions on this subject? Okay, seeing none, hearing
Chairman
none.
Larson, Chairman
Yes.
Larson, I say one thing. I just want so members realize. So right now there's 10.4 available, but with the Park District that actually is now we have 9.4 million available for the initiative. So at some point over the next couple of months, we do need to figure out the direction you guys want to go with that, but that is available for whatever initiatives. But by the end of the, obviously August or something, probably a pretty good direction on that. Thank you.
Yeah, we realize that we don't want to just account for every single dollar right now because we don't know what the next few months are going to hold. You see the contingency funding that's set aside at this point. Nick just clarified that. Everybody comfortable with that? Member Ozog, I see you have a comment.
Yes, at the end of our meeting, I just want to thank Member Chaplin for calling for us, for having this special call at our last board meeting. I think it's been very positive, and it's been a really good way for us to go through all of these items. And I'd like to see this kind of meeting replicated when we get to our 2021 budget workshops. Thank you.
Thank you. No one want to thank me? No, I appreciate this.
One other comment.
Yes, go ahead.
I'd also like to thank Chairman Larson because we are now heading into our 6th hour, and you have kept everything really straight. Everyone's had fair turns, and this is a challenging meeting. 5.5 hours is, thank you very much.
Thank you. It is challenging, but I think we got great feedback from the board. The staff has been
It was
phenomenal.
very
I
positive,
appreciate
but
it.
thank you. You kept it
Thank
all
you.
as straight as possible. Thank you.
Member Dessart and then Member Eckhoff's cat seems to want to comment after.
I'll second that. Thank you, Chairman Larson, for running such a tight meeting. Good job.
Thank you. I appreciate it. Member Eckhoff, did your cat want to comment? No. Okay, good.
Yeah, he always wants to comment. Meow.
All right. I don't even know where to go with that. So we don't have any old business or new business. I think we are prepared to adjourn based upon the new guidelines. We do have to take a vote.
So moved.
So we've got a motion.
Second.
And a second. If we could please call the roll. And the motion to adjourn.
Member Elliott,
Aye.
Member Hart, Member Healy, Member Krajewski,
Aye.
Member Larson,
Aye.
Member Noonan, Member Oza,
Aye.
Member Pachowski,
Aye.
Member Renahan,
Aye.
Member Rutledge,
Aye.
Member Selman,
Aye.
Member Tornatori,
Aye.
Member Zay,
Aye.
Member Chaplin,
Aye.
Member Covert, Member Desart,
Aye.
Member DeCiani,
Aye.
Member Echo.
Aye.
I saw Member
Healy,
Healy,
aye.
but he
Healy,
looks sort
aye.
of like Healy. I don't quite recognize him, but.
He's been hijacked.
Healy, aye.
All right. Thank you all for a great discussion. Appreciate it. Appreciate the staff. Have a great day. We are adjourned.
Great job.